Hello, hello, check.
Good morning, everyone. Am I going to get a response? Okay, good. Thank you. Welcome to the Mizoram University Health Festival 2023. This program is jointly organized by the Mizoram Students' Council, the Discussion Forum, Red Ribbon Club, Mizoram University, MZUSC, Mizoram State AIDS Cell, Mizoram State AIDS Control Society, and UNICEF. All of us know, I'm sure, the full form of UNICEF. So this program has been organized through sponsorship by MZUSC and UNICEF, and with all the administrative support, logistical support from the Mizoram University Administration Department. This program has been organized as a part of the ongoing IEC, that is Information, Education, and Communication Program of MZUSC, Mizoram State AIDS Control Society. From the name itself, we all know that MZUSC deals with or addresses the issues of drugs, addictions, challenges, and also HIV/AIDS, right? And the Department of Psychology and the Department of Clinical Psychology, Mizoram University, deals with or addresses the issues of mental health and mental health issues, right? So I would just like to add a little bit here, information for all the students, that the Mizoram University has a Mizoram University Counseling Cell, which is located at the Department of Psychology, School of Social Sciences. In the next maybe couple of weeks, we will be distributing and we will be identifying departmental coordinators amongst the teachers so students can report if and when they need counseling, therapy, or any other challenges that they face in life. The counseling center is functioning. There are 10 counselors identified from amongst the teachers of Mizoram University who are experts, who have done trainings, and who have diploma course, etc., experts in the field of therapy and counseling. So all those of you, of us, who have issues, mental health issues, please do not hesitate to come for counseling or therapy. Okay, I would just like to add that little bit. First of all, I would like to welcome the chief guest, Professor Vanal Sona, the Finance Officer, Mizoram University. Welcome, sir. In spite of your very busy schedule, you have made time for us, noting and acknowledging the importance of the issue of HIV/AIDS, drugs, as well as mental health amongst the Mizoram University fraternity. Thank you, sir. I would also like to welcome Mrs. Lalne Zeli Silo. She is the Assistant Director, MZUSC, the Youth Branch or the Youth Department, Mrs. Lalne Zeli Silo. I would also like to welcome Mr. Andrew Lalbiak Nunga. Incidentally, he was the, which batch were you in? 2014 psychology batch. Currently, he is working as uh, State Nodal Officer for the UNICEF Adolescent and Youth Wing of UNICEF. If you look at the program, you will see we were expecting the main person, but there has been some issues. So anyway, welcome, Andrew. Good to see you again. And I would like to welcome all the students, the class representatives, assistant class representatives, and faculty members of Mizoram University. It is indeed a pleasure and a privilege. We really appreciate your time and your participation. We know, and you know, all of us know, that the issues and challenges that we are going to discuss, that we are going to ponder on in the next 2 days is very, very important. These are issues and challenges which have not been addressed. They have been addressed now and then, but not in depth. So we hope that you will be trained, you will have the capacity, ability, and the training to be master trainers for the rest of your classmates in the department. We know that it is not possible to suspend classes because class suspension keeps on happening, and Virkli is in the near future also. So we had the Vice Chancellor, Mizoram University, has kindly consented, kindly given us permission to invite the 4 people only from each department. But the 4 people from each department will be, you will be identified as master trainers. Later on, we will expect you to give training, awareness, not a step-by-step, not the whole, whatever points, whatever is important, those will be distributed as guidelines, pamphlets, leaflets, etc. later on, that you can disseminate to the rest of your class, so that you are the privileged ones today and tomorrow, and that privilege will be shared with the rest of your classmates. Because as I said earlier, these are very, very important topics for the youth of today, and even for us senior people. So welcome to all of you. We hope that you will be able to participate in the next 2 days. Today's topic, as if you look at the program schedule, very, very important issues. Tomorrow also we will be talking about mental health. And specifically under mental health, we will be talking about coping and stress management. Stress management, which is a challenge which many of us face. Young people, young adults, older people, etc., etc. So we will be having a 2-hour session tomorrow on stress management and coping. Okay? So we hope that all of you will be present again tomorrow for the workshop. You may think that this is outside of academia. I was just discussing with the chief guest, and under NEP specifically, you have field work, you have projects, etc., etc. So this is part and parcel of the field work. This is part and parcel not just for your personal, you yourself, your personal life, but for your skills. It's a part and parcel of skill development. Because in the exams, what you do is you just read the theories, whatever you have been taught in class. After you finish your master's, even if you do some other courses, that does not empower you to a great extent. With all these trainings, workshops, seminars that the university is offering to the students, it is empowering you. It is enhancing your skills. When you go look for a job, the interview board will not be asking you, what is, please recite, or please tell us this theory, that theory. That may come, but they will be assessing you on your potential, on your capacity, on you as a whole person. Obviously, degrees are important, for first class, etc., etc., very, very important. But at the same time, who are you as a person? Do you have the potential to take up this job? That is what we're talking about, okay? So I would just like to give a brief introduction into what Red Ribbon is and what is the latest HIV/AIDS statistics and drug statistics in Mizoram. Okay, so those of you who want to note it down, you can do so, but we will be including this in the pamphlet leaflets that we will be providing all the master trainers so that you can disseminate it to your classmates later on, maybe after Virkli or maybe the month after, okay? So the Red Ribbon Club was started by the Government of India in 1993. Its aim is to spread awareness on HIV/AIDS, including this in the voluntary blood donation among youth in educational institutions. It also aims to identify, prepare, and promote peer educators among youth within and outside institutional campuses. So as we all know, that is the aim and objective of the Red Ribbon Club. Purpose of establishing Red Ribbon Club in Mizoram University: to highlight the status of HIV/AIDS in Mizoram, to help and support people living with HIV/AIDS, to promote blood donation, to encourage students to be regular blood donors, to help and support people who are dependent on drugs and alcohol. The activities of the Red Ribbon Club has been organizing blood donation. Way back in 2012 and 2013, we had done blood donation at the Mizoram University level. Later on in 2014, 15, 16, 17, together with the NSS, we had also organized in collaboration with the NSS. The NSS has been kind enough to include us in their blood donation. So we would like to thank the NSS also at this point. And the status of Red Ribbon Club in Mizoram. There are 44 colleges and institutions in Mizoram that are having Red Ribbon Clubs, including Mizoram University. So since we are the only university, we are the only university in Mizoram having Red Ribbon Club. And the Red Ribbon Club was started in Mizoram University in 2011. All of you were born, but you were not studying for your masters then. Even one of our resource person today was still doing his probably undergraduate at that point of time. It started in 2011 under the aegis of the then Vice Chancellor. It started on the 6th of September 2011 at the M Hall, Multipurpose Hall, under the then Vice Chancellor. So we have been doing, having a lot of activities here and there, peer educators training, HIV/AIDS awareness for the students, for the faculty, etc., over time. And we have always observed World AIDS Day, which falls on 1st December. Currently, the nodal officer is Professor Zo Engpari, Department of Psychology, and then you have 11 link officers from different departments of the university. They are Professor Lalni Loma, Professor Margaret L. Patsuao, Professor N.L. Senthil Kumar, Professor Lal Biagdiki Namte, Dr. Zodin Puya, Dr. Irene Lalwat Kimi, Dr. H.T. Lal Remsanga, Dr. Esther Lal Mingliani, Dr. Elizabeth H., Dr. R. Lal Sanhima, and Mr. Lal Shwailiana, Department of Sociology. I have not mentioned the departments, but they come from across the Mizoram University. So that is the background information on Red Ribbon Club, Mizoram University. I would like to share next the current HIV/AIDS status, the latest September 2022. Starting from the records, the data has been collected or has been, is from October 1990 to September 2022. The current total from 90 to 2022 is 27241. Total number of HIV positive people, 27241. I will not give out the breakup because there is less time also. But as I said, we will be giving this information later on, okay? That is the total number. And in 2023, the statistics is still not available. So hopefully it will come by in the next couple of months. Then we can be aware of the actual status. With regards to the drugs scenario, Mizoram has about 27,000 users, opiate users. This statistics, this data is from the National Drugs Survey of India 2019. Okay? Since it's a 3-year, 5-year data collection method, the latest is still not available. But the latest is 27,000, and that too opiate and its byproducts, its derivatives. In the year 2023, there has been 19 males who have died from January. Now it's March. Today is 9th of March. There has been 19 males, Mizo males, who have died from drug-related problems. And there are 2 females who have died because of drug-related issues from January to 9th of March 2023. Okay? So that is the information that I would like to share with you at this time. And once again, I would like to thank the Students' Council, who have been the backbone, as we all know, and the discussion forum. Without them, nothing is possible. They have done everything, all the work streamlined, taken up all the nitty-gritties, so to say, all the detailings, the program, the poster, etc., etc. Oh, before I forget, we have also organized a poster competition. And when you come up the steps in the lobby outside of the auditorium, you can see the posters. So tomorrow afternoon, there will be prize distribution for the first, second, and third prizes. So once again, welcome all of you to the Mizoram University Health Festival. I would now like to invite the chief guest, Professor Vanel Sona, to give a short speech.
Good morning, everybody. Respected Chairperson, Professor Zoe Mpari, Head Department of Psychology, and the Nodal Officer, the Red Ribbon Club, Mizoram University, P. Lalneizeli Silo, Assistant Director, MZUSC, and Pu Andrew Lalbiaknunga, who represented MZUSC at the same time, who is now working as UNICEF Adolescent HIV Project under Mizoram government. Distinguished professors, teachers, students, ladies and gentlemen. Immediately when I sit up with Madam Chairperson, she told me that, sir, if we neglect HIV/AIDS issue, this is the surest way to our distinction. So the topic, the issue is very, very important. So we cannot neglect this issue. She told me something like that. So today I am attending, I know, a very important meeting that could tell the futures of Mizo community. So I'm really thankful to the Madam Zoe Mpari for inviting me to participate in this inaugural function of Health Festival 2023. As we have heard, this being jointly organized by the MZU Red Ribbon Club, MZU Student Councils, and MZU Discussion Forum. As she has already mentioned, the Red Ribbon Club of Mizoram University ever since it was started in 2011, had been actively involved in spreading awareness on HIV/AIDS and promoting the value of voluntary blood donation among the university students. As she mentioned, several programs like quiz competition, debate, slogan writing, painting, essay writing, seminars, workshop on HIV/AIDS awareness had been organized several times over the last 10 years. Today, on my personal behalf and on behalf of the university fraternity, I would like to acknowledge the hard work done by our Red Ribbon Club, Mizoram University, and I deeply appreciate their relentless effort and commitment and dedication in educating and creating awareness on HIV/AIDS among the students. The university fraternity is with you in the fight against HIV/AIDS and promotion of voluntary blood donation among the students. As we had heard, HIV continues to be a major global public health issue, having claimed more than 40 million lives so far. As on 2021, an estimated 38.5 million are living with HIV/AIDS. And according to the region classification made by WHO, the WHO African region had the highest percentage of HIV prevalent. More than 25.6 million are now living with HIV/AIDS in this WHO African region. Almost 70% of global HIV victims are in Africa. This is the information I got from the WHO website. Globally, the prevalence of HIV among adults 15 to 59 is 0.7%. In India, 2.4 million people are living with HIV in 2021. The estimated adult HIV prevalence trend has been declining. This is the good news about the national level, and it is getting stabilized at 0.22% in 2019. At the national level, at the subnational level, at the state level, the three states with the highest adult HIV prevalence were from the northeastern states of India. Mizoram prevalence rate is 2.32. Nagaland is 1.45, and Manipur is 1.18. So every time 100% sit together, at least 2 to 3% are supposed to have HIV infection. Okay, this is the situation, and we are now. You might be recollecting the SDG target 3.3, that is relating to communicable diseases, which state that by 2030 we should eliminate the epidemics of AIDS, TB, malaria, and neglected tropical disease, and combat hepatitis, waterborne diseases, and other communicable diseases. Now, as we have just mentioned, Mizoram poses a special challenge, as the state has the dubious distinction of being the highest AIDS prevalent state in the country. The prevalent rate is 10 times higher than the national average. Mizoram has more than 27,000 people living with HIV/AIDS, and the disease so far claims almost 4,000 lives since the case was reported in 1990s. So it is time to enhance our effort in the areas of information, education, and communication. I hope the present Health Festival 2020 will open new windows of opportunity to have greater access, reaching to the key target groups. This is my observation and my request to all of us. We need to enhance, as an educated community, the threat our state is facing. So our chairperson could not sleep anymore because of the threat of HIV/AIDS. She is afraid of the distinction, not from political assimilation. Our real threat is HIV/AIDS. This is now the situation we are having. So we, the educated community, has a duty to respond to this challenge. We need to spread an awareness on HIV/AIDS issue. Now, aside from leaving aside AIDS issue, I want to dwell upon one topic I would like to share with you on this occasion. This is relating to our state health condition. Our state health system comprises of public and private health service provider. We have government-run hospital, we have private-run hospital. And what we know is several of the publicly provided health system which are spreading across the state are running without regular doctors and nurses, where the supporting facilities are poorly provided, and even the existing ones are very limited, and many of them are not properly maintained, so they are not working. So even basic diagnostic facilities are not available in these health centers. You have the building, but they don't have the medical equipment. This is the situation in respect of our government-run health institution. This is so bad. Now, meanwhile, as you know, private hospitals, which are much better equipped and well managed, are very, very expensive, beyond the reach of the poor household, and several people in the rural areas could not afford to get any treatment in these privately run facilities. How can we address this inequalities in health facilities? This is our greatest public policy challenge. So in order to address this inequity in health access, facilities of government health care centers, that mean primary, secondary, and these tertiary centers which are running in some other areas other than Aizawl town, may have to be strengthened. So, and at the same time, we have to strengthen, or we need to work out a mechanism whereby even the poorest of the poor could get the base of the base medical treatment in the state, and that is possible only if we provide easy and simple to access insurance policy. Our insurance policy in our healthcare sector is almost a dying phenomenon. You don't have any expectation. It took 2 to 3 years to get your medical bill reimbursed. Such is the situation. We need to address this, and the public should demand that our health system must be improved, must be able to function to serve the society. So the National Health Policy 2017 envisages that total expenditure in the country must be increased from 1.15% to 2.5% of our GDP. we are yet to reach that 2.5 percentage. And the National Health Policy also suggested that 8% of state budget should be allocated to health sector by 2025. Health expenditure should be at least 8% of the total expenditure of the state budget. Now imagine what is the situation today in Mizoram. Mizoram government, as per 2023-24 budget estimate, we are able to allocate only 5% of the total budget to the health sector. And our public health expenditure as a percentage of GSDP is hovering around 2%. So we need to enhance public allocation to the health sector. This is the real need of the society. So we must increase the level of health investment at least to 8% of our state budget by 2025. So I would like our students should impress upon the public, the voters, that our health expenditure is very low in terms of government allocation to the health sector. This must be increased. This is our right. We should claim it from the government, okay? So health is very number one issue in human capital development. We just simply cannot ignore the health sector. So this is our priority. Our priority should be those health centers, hospitals, institutions located in some far away from Aizawl be given regular doctors and nurses and more medical equipments be provided with this, be provided to these health centers. So I wish the Health Festival 2023 a very grand success. And at the same time, I hope that the workshop and the seminar program may enrich abundantly all the participants. Thank you very much.
Thank you very much, Professor Vanel Tsona. The speech came from the heart. Speeches are given, but it's just reading out. Sometimes it's reading out of what has been prepared by the secretaries, etc., etc. But then the speech that we have just heard is something which came from the heart. Thank you very much, sir. And we hope, thank you for the information on the general health scenario of Mizoram, and also the status of HIV, AIDS globally, nationally, and state. Thank you very much, sir. So next I would like to invite Mr. Andrew Lalbiak Nunga to give a short speech.
Thank you, Madam Chairperson, Professor Zoeng Pari, and to the Chief Guest, Professor Vanel Tsona. And thank you to the MZU organizers for including us in this Health Fest. So first of all, I would like to apologize on behalf of Dr. Rebecca Sharma, who could not be here because of some unforeseen circumstances. And she is the UNICEF state consultant. And I myself, as you have heard, my name is Andrew Lalbiak Nunga. I am the UNICEF Adolescent HIV Project state coordinator here in Mizoram, Aizawl. And today I'm not going to give much of a speech, but rather an introduction into the workings and nature of the Adolescent HIV Project. So the Adolescent HIV Project is concerned with 10 to 19 year old adolescent who are at-risk population. And the UNICEF have 3 pillars which we hold, that is pediatric care, adolescent care, and the parent-to-child transmission. So out of that, I am concerned with the adolescent care, and right now, as you might have heard, there is a very high percentage of HIV positive in Mizoram. It is highest in India, and it has been rising each and every month. And this impacts all of us, as you might have imagined. And right now, there is also an increasing rise in this drug consumption, as you might have heard, even in schools. Children from 13, 14, 15, they start taking orally ingested drugs. And we all know about the number 4 epidemic that is coming up right now, which is affecting a lot of young boys in general, 15 to 24 year-old boys, especially in the border areas. So last year we visited Long Klai and Saiha districts. There were towns which have over 90% of their youths, male adolescent youths, involved in drugs. So that is the condition of our state right now. And the AHP, we are concerned with adolescents, as I've mentioned, and there could be 2 types of adolescents right now, which is in-school adolescents and out-of-school adolescents. So we focus on both those 2 groups, and our main focus is to spread awareness, to protect the adolescents who are at risk, and to equip them with the right tools and knowledge on how to, protect themselves from HIV/AIDS and from drugs. Because you might think it might not concern you right now, as you are all above 19 years, I believe, but the adolescents are our future, right? They are the foundation of our society. And you might all be related or know some children. Either they may be your siblings, your cousins, or your nephews, or children in your communities. We, as educated, privileged people and graduates, it is also our duty to help these children and to help them cope with these changing times, in this age of social media. We have to educate them as best as we can. And also we have to keep in mind the importance of the well-being, the physical and mental health of the adolescents. So right now, we are working on these Rashtriya Kishore Swasth Karyakram modules for government school students. Right now it is available only to government students, and the modules include things like mental well-being and sexual and reproductive health. So right now we are working on that module to be available to the private school students, because we all know that there are more private schools and private school enrollments than government school enrollment. So that is the major task that we are doing right now. And we are also located in MSEC's office and the HS School Health Office. So if you want anything, if you are students or members of the Red Ribbon Club and you are interested in this kind of adolescent HIV, we are making a state profile right now, so you are all welcome to visit us in any time you want. So thank you.
Thank you, Mr. Andrew Lalbiaknunga. It is indeed a pleasure to see one of our alumni come here as a member or as a person working in this area. Thank you very much. So next I would like to invite Mr. Ramnun Sangapautu, Chairman, Discussion Forum, Mizoram University, to give the vote of thanks.
A very good morning to all. I will make it in brief. It is an honor for me to offer a vote of thanks and acknowledge the contribution of everyone who put in lots of efforts to make this event possible. I would, to begin with, I wish to express my gratitude to the Almighty God for providing Mizoram University Health Fest 2023. I would like to thank our chief guest, Professor Vanal Chona, Finance Officer at Mizoram University, for kindly accepting our invitation and spare a time from his hectic schedule to grace the occasion. And sir, we are very, very lucky that we can hear your inspirational thought. Thank you, sir. I would also like to thank Mr. Andrew Lalbiaknunga, State Coordinator, Adolescents UNICEF AIDS Project. Sir, we are very lucky to hear your deep and intellectual way of imparting knowledge that has added to the glory of this event. Thank you, sir. And I'd like to mention Ms. Lelne Zelisayo, Assistant Director, MZUSC. She worked really hard with us and put a lot of efforts to make this event fruitful. Thank you, ma'am. And a special mention to our respected chairperson, Professor Zoeng Pari, Head of Department of Psychology, and Nodal Officer, Red Ribbon Club, Mizoram University, who really work hard and guide us to make this event possible. Thank you, ma'am. I would like to thank our main sponsors, Mizoram State AIDS Control Society, MZUSC, and UNICEF AIDS Project. Their contribution make this event possible. Also, I extend my heartfelt gratitude to the organizing committee, Red Ribbon Club, MZU, Discussion Forum, MZU, and Mizoram University Student Councils. I also like to thank to all the participations who spare your time and for your active participation that make this event fruitful. Lastly, but not the least, I would also like to extend thanks to anyone I might have missed. I also like to thank the IMCR, NARI, Dr. Henry and his team for conducting a free HIV testing to know our status. And lastly, thank you to everyone. Thank you.
If we look at our schedule program, we are a little bit behind time, but I think it can be made up. So we will leave the dais, and I would like to now invite Dr. Elizabeth H. as the moderator for the session number 1 of the seminar. The session is, the resource person is Dr. Samuel Lazar Loma, Superintendent, Serious Home. So he will be talking on the ill effects of drug use. So Dr. Elizabeth H. Okay.
Are we understanding Mizo or not? Every one of us? No. Better to speak in English, right? So bilingual, okay? Be comfortable. So what we'll do is that we'll start the session. You please come forward. You please come forward. Amhala maron traffic role. Hey, Amhala, you please come forward. Invite in. Ron chum Amhala maron churo. Oh. Amhala maron traffic role. Ron traffic role Amhala makhan. Asan tumo tu soite in response ka harsan ito seminar agin kan kay don siya. Oh, are you ready? And then, if anyone want to go to the washroom or loo, just 5 minutes, you just go hurriedly and come back. Zung dute mo bedroom mang dute nom tuan. Why are you so cool? Nga thinking in Vangoy Toy, why are you so cool? Be alert. Good morning. Yes, good. We're going to start the seminar with such interesting topic. Okay, such interesting topic. You must come from diverse department, right? Am I right? Sciences, life sciences, physical sciences, like that, social sciences, humanities, semis, okay. Whatsoever it may be, the conclusion is that you are a human being. That's it, okay? So today, we'll be talking about a very, very burning and alarming topic, which is about drug addiction, okay? And then the speaker will be Dr. Lazar Lomasailaw, Sarzara. And then Dr. Lazar Lomasailaw is such a dynamic practitioner, really practitioner, not theory-oriented. I feel the and then he's not a new person to this university. He has been awarded PhD from the Department of Social Work, Mizoram University as well. Okay, he used to be my teacher as well. So it is an honor for him as well as for me today. So he will be talking about ill effects of drugs use. You must know what is drug addiction, whatever it may be. But then it may be quite different from what you have already know about the drug. So he will be having his session up to 12:30. Okay, from 11:45. Okay, to up to 12:30, which means that only we have 45 minutes with him. So if you have any queries or doubt in the middle of the session, what you could do is that you could raise your hands, okay? And then he will note it and then reply you back at the end of that session. So do a more shared bell, do shared zao, do in the sort in could in parang asoy like han, in zo tanga allow ziak, meng allow tinsia, menga. Session topa aron chang me lo so hobin so be comfortable, invite in comfortable row. Don't think that it is a classroom mo share ma se mutu oi lao session laya chwa sek te oi lao phone na ti ve vek te oi lao chuan in phim kur ngai teu chu an live teleka sin ka sia ni sin khan aling te khan ron da vel chu ba ja de o mangai. Okay, so Sir, you may take up your time, please.
Thank you, Miss. It is really an honor to be here, privilege for me. As I'm already introduced by Madam Ali, I'm also a part of MZU. I did my PhD here under the supervision of Madam Kalpana, but she's not here. She's in Guwahati, in TIS. And today, I really thought that I'm going to present the presentation in Mizo, because I'm more comfortable and I'm not closely associated with the MZU. Previously, I used to give some presentation and lecture here, but it's a little bit difficult for me. So since the presentation is in English, the bullet points and everything, I'll also mix up with English, but most of the part of the presentation will be in Mizo. Will it be okay? Apoy em karin buat. Ai lo chana rei don lu tu ai buat sei dat kha ka thak tu thei box si lo wa. A medium kha bizo to pon poi lo master trainer student ni ti phang khan. For this so and some of our non-Mizo students, I hope your friends near you will be able to assist you, support you in translating whatever I'm saying here. So it's a very important topic, as already mentioned. It's ill effects of drug use. And so as we are very much aware of our current Mizoram scenario. The prevalence of drugs use, abuse, and addiction is very big. It's a big issue. And if you go through the dailies regarding the supply, there's a seizures of drugs, illegal drugs every day. And ma'am, umai katimeti pimai, and how to know point out so kan opiate user people who use drugs ka 20,000 pialam pangka injecting drug user kan omani. Then there are many children with substance abuse. As ma'am has already said, I'm the superintendent of a serious home for children with substance abuse. So, no pang kum som priyan nuay lam pang po ha ti treatment lak ngai to kop who are addicted akha tam takan omani. Prison lam pang kan en chuan, if you look at the prison, 80% ka drugs kai noi an lo ni ta. Yang chuan a boy thla khop maya kan ram tin mun kha. So chim ka tum lo he lam pang chu. Chuan thi na chung changa po khan kumina ringa po an thi nem to. Kumina po som ni pakhat mo me chia som. Me chia pani me pa som pakwa march ni khat. And statistics kan en chuan kha khani ta. 1984 atang khan kan thi mi to ni tin zoo awanga thi na po atam chuan accident sim hi 70%, road accident 70% he under the influence of alcohol upon drugs mo khani tani. Chuan health statistics kan chuan the 4 major causes of death cancer te drug related ani mo tambal chu drug related ani, tobacco, chuan pneumonia te tin hemi cardio gastrointestinal mo hangte, chuan asthma te hang song kha malaria hi pani na ni malaria chu anilova abak pali kha drugs awanga ni tin statistics tu ngai kan en chuan KTP mi pathi kha 80% vel ni true hang song te kan en chuan the prevalence of drugs achan kha zir chian tur ani students chuan mi kan su pu ngot theilong point me the research angai ni point me the achan kha zir chian tu ni maro chu achan langsar tin electoral roll te pon en chuan 30 plus a khan mi pa kan claim to me chian tam zo to chu ni kha zu khriat sa tiru tun nai kan wanglai ni te kan en pei chuan wanglai la daily chok shim khan en chuan mi pa nga tinge mi pan thi tam chu ti tam tak om ni drugs kai noi ti lo thei lawang comorbidities HIV drugs chuan HIV induced drug induced HIV kha aum bok ta ni tam ta ni tuna chuan root to sexual anita sex anita amaro chu drugs awang khan atam ani tin asek ngei po chu zen taila under the influence of drugs ani awang khan condoms khalo manglo ani theisin mo chu wang chuan HIV ka infection chu ai kai noi thuk na sa ani chu tin mental illnesses khang chi sang kha a ombokani comorbidities hep c tiang sang kha. So the prevalence is huge. It's a big issue here in Mizoram. Pakhat na kan ni na tamani opiate user kan ni HIV kan ni cancer khang song te khan en chuan. So it's a very important topic. Voina kan ti le kan work kan seminar sim hi apoi mo in ma in lo lak to na zong te red ribbon club te student councils te tilai munarung kalkhom te blood donation khang song kha apoi mo ni ti kha thu ma angin kan soi ni chu employee say what is drugs? Any substance that when taken by a person modifies perception kan mudan mo kan mudan te kan thir dan te kan mood te kan real suit clek te kan cognition is our thought process mo kan thought te kan behavior kan nung chang te kan motor function kan che zia te kan behavior khang song kan han emo kan in emo whether the route of intakes might be inhale or kan orally ponite injecting ponite ma se khakhan a modify ta ni heng kan taksa le kan rilru ti to mengo mentally physically ya substance substance reng khang ti na modify sakham drugs kan hanti chuni ta chuan chu legal drugs ani the illegal drugs ani the ta ni prescription drugs ani the over to counter drugs ani the ya a eng poni ta chen chu den right te poni the ta ni drug medicine poni lo mai the chuan chen chu na ro poni mai the ma se chuan a to phoka chun dependency addiction a khan azulut the ta ni addiction a alut the ta ti khari ta kan sei por por chun discussion le zona ang chi te po emono mani zok poina in soi du a kha omani chuan kan mi sina soyang khan kan soi hodon ne. If you have any queries or if you have anything to add after the presentations, there will be a room for it. Okay. So ka big lo na mani peer chunga in peer helai university chunga enge attend enge kha ka hrelowa chunga te po chon contribution to emo discuss to them omzok mai the ni kan kal de por ange okay dependency kan ti chuan so this is dependency addiction. All drugs can lead to addiction ka arab tha kani mi addict to chuan a focus le a motivation ka it's purely on drugs, how to get it. A drug seeking behavior ringot khani to mo education seeking behavior nei to academic seeking behavior nei to lova family healthy takane seeking behavior khani to lova drug a focus on drug seeking khoi nge ka nei thenga tinge ka nei thenga khoi nge ka zoranga ti ringot a health po prioritize to lova mo a health a prioritize to lova a azon na mo an tho na mun awo po a prioritize to lova a prioritize to drug khakhani tani chu dependency ni tani chuan tolerance le withdrawal o ma dependency a chuan addiction a chuan tolerance ti chu a dos a sang chhozel voi khata tia lu haya kai chak no khata kai chak thin kha hun rei to taka chuan khate du to khat bona kai thamang to lo amai thri dan khan mo chu tolerance kha loin develop zela taksa khan lo ngai thei tial lo ngai tial to pa chuan addiction a khan alo lu ta ni alo mo tam tial ti na ni chu then withdrawal kha lom le bokta chu po chu kan discuss withdrawal chu at rethei thil kha ati lo thut khan ataksa khan a confuse ta ni chu rebel chuan ngati nge ni antia taksa bung sang chung le pona mi sense zong kha an helta chuan an tuara drugs ka du chu a withdrawal symptoms ron lan na ani luak chuak te ko thalo te ru za te khang zong kha alo ni ta poni se dependency ti kha ta drugs chuan addiction a khan mi a hruai lu thin ani chu ara phak ber drugs a hian enge a ill effect ra phak ber kan ti chuan addiction hi ni addiction a mi lu to chuan apoi ani addiction term a definition kan chuan it's a chronic relapsing disorder the tamo obsessive compulsive drug seeking behavior mo obsessed mentally is obsessed always obsessed about how to get drugs mo compulsive a behavior a control to lo a impulsive to ni chu ti nge ngai chu impulsive to tu a inhibition te engkim me kha a control the to lo chu ni drug in a control to chu chuan addiction chu alone ita the vicious cycle of addiction ita mina an ngei pon hun reilo te khan triggers tu amu chuan a thian te mo a drugs ti na thin te mo a damdoi ngei te mo a zu ngei te mo a mu chuan triggers khan aron triggers a ti cha ka den mang theilo ti anuang mo tanga kho chiat dan chu vo in tlai chu weekend ni tlat me a chu an fantasize ta di khan angai tua ta to pa chuan substance use chuan loss of control ti khan avir ta de chu mo khami ringot khami cycle ringot ta khan addiction a chuan alo om tan chu apoi em maya chuan apoi le chuan la chu mi ai addict to chuan ka soidan tur hi thui taka chip chia taka han soi ai chuan tiang ti hian han soi tai la thain ka hriam a learning process te a learning hey tu na chun lek hazirin ni ta academician academic te thil zir like an ni amma ero chu mi ina drugs atia a abuse a addiction alu to chuan ni china kan soyang khan a drugs ti dan khoi tenge an ne anga khoi ange a zoranga entinge ati ang bak hi ngai tua thei din huna hian om lo ani chu athiam ma chu chuan a personality a zia te a trait zong te kha kuman ve chuan aron ne ta ni tuna hian thil reng po ka nei nga langai king baby syndrome man tiang deu khan tuna nge ka nei ngai ka nei nga langai ka nei nan chuan dot sei bo poilo ruk po poilo kha zong kha impulsive deu khan aron om hal zung ta ni poi me chu no pangina drugs alotia abuse chuan a social skills zong azir thina po kha atop mak moi ni mo life skills kan tiang chi kha life skills self awareness kan ti te communication thinking skills creativity khang zong kha drugs ati to chuan a thei to lo a drugs nei nan emo mi abum nan emo a zor nan emo a ruk nan khan chumi ringot chu ni mai mishing pa ngai tung chawina anin communicate dan tur te emo nu le pa te chung kwan nun ho dan tur thian te peer level a te tin khatianga an om chu dan tur zong social skills te po a than thu vekani chuwang chuan apoi ma a learning abilities kha ati toi ati than thu ani tin a concentration shrim kha ati attention pek te concentration te khang zong kha a khoi chebokani ti khan kan peng kan soi du ni chu apoi na ill effects kan han ti khan chu addiction ai chona poina mania tal chua a har to lutuk karon motora karon chuang tha chuan radio karon ngai tha pian sual na hian tlai luat ani lo ti karon play ra ta o valmoi in chuang mai lo la pian sual hian tlai luat ani lo ve ati kha a drug sampang zong te bo khan kan ngai to ta hey no pan deu lai hun chu addict theina hun chance kha sang ti khan ni thina amma ero chu hey na tho to nuwa po MCS ani to nuwa po addict tlat mai ang chi te po kan rama hang kan nei ni mo chu van tlai tak om lo zuom sual theiani ti kha kan hria thi poi mo khop mai lai rong kal chu master trainers te kan ne ho tu te zo kana university a phei chuan MA kan ni to lom le tia a hetiang zir to kan ni lom tia ngai tha mai kha ol donin ka hria amaro chu a addict thei ani ti laia kha tlai tak om lo ti lai kha kan soi le du te ne classification based on central nervous system ta hey depression stimulants depression hemi kan central nervous system hanti mu hanti zuai the mo khatiang kha hanti zuai the zu te chu ngati nge kan ti tho lo han pek khat han per phe kan phur hloi mo kan ti deu nge kan tha thon lo mi ti body the ama chu kha ni lo kan inhibition na kha kan control kan in zoom theina kha azu tin nam pa ti meng kan za zoom na te kan har deu huai a kan hriat wang mai ni ama ro chu kan che te kan nervous system kha mi zong kha suppress a depress in tam tial kam mota function por roi ro kan o ka te po aslar to a mo ngai tu na po amwang angil dup to mai ni khatiang chi ho opiate te ne sedative hypnotics kan ti te voltage solvents kan ti hi chu hey dendrite kan han tiang chi te ni yan na tu na khian cannabis ki stimulant angina thok theya depression angina thok thei boka hallucinogen angina thok thei boka ni jon LSD ti te PCP hey mushroom atang CMT te cactus atang CMT te ti khan han Google ula chiang zokin in thei mei theya khanga khan rethei thil classified dan sim kha central nervous system atang khan mi han ti tha tho thei depressed thei le hallucinate the mo kan perception te ti buai the thil mu benga hriat te ti buai the intense twin siam theya mo rong te po ari hretlat me music te po a mu thei tiang chi khatiang khop distortion kha khati khop khatiang khop kha om hallucinogen khami kha khatiang chi ho ka LSD kan han ti te ne kan rama chon cocaine kan ti te ATS kan ti po hi a tol ruk a supply lampanga khan a chain chu a thakop maya a siam na kan tol chawa mo pseudoephedrine kan tol chawa chuan he ta aron kaltlang international market a tha em a nitin kan riat nu vekani turu hei chu chuan a system la hian sum le ni na hin lo du boxia zalen takin trafficking poya kal zelani hi mom chu boy thla khop mai poi se amphetamines type stimulant kan ti met kan ti chu ti em ina popular lem lo wa hei chu recreational drugs kan han tiang chi khani ta amor chu ala khoilai mo chuan appear deule thadeu chu ala luar ve lawang ti soi thelo chuan mun dai ro chun mizo nula tlamwal mangte tam takan om ani metro mun sang ate hey tobacco po hi stimulant drugs ani addictive sia kan sia effects to kan se fo ome chu ani ta heta hian cannabis hi ni him tur anga zungai na changkang anga zungai na an glamorize ani mo tura chon khun tam taka phe chu an legalize amaro chu weed kan han tiang chi cannabis sia hey tuna bhang te phe chu india ma chon phal ani thauta leaves khami an puja le thilti na vera shivan biang na ten manga maro chu hei hi a him a om lawani psychotic lutuka at pha theya tin arui laya kan omdan a intoxicant a effects akha mo acute intoxicant effect kan ti meidon mi khati hun laya mi a omdan khan poitam tak atana ham theile bidang tan ham the a thleng thei boka ngai sam na le khang song song kha a oma cannabis hi zuam mei chi ani lawani tin stress relief nan an tiama se stress relief na tur hi ai tha tak tak kan la zir teu doning ka ria nak tu lama te po chu ani a hei hi chu mun ram dang an phal lom te adanina phal zong zong hi a thavek pon hi chuang lo zu te po kan phala kan phal lo wa a thi pui chu an thi chur thawa che pan che dan kha chu tiar lo om mei ni mo po se an ram din mun a zir khan enge thil thleng an sum le pai din mun te tin a mi hring anin en kol dana te khan khamia wanga lo lak la ve ngot chi ani lo zia akha zir chi ana riat chian a ma ni chu hei hi drug use kal choda atira chuan experimentation ani thir ni hei kan rama chuan availability he sang khop mai turu number 4 te hi heroin te asang mani phone call in zu po deliver thap thei drugs heroin po a deliver to in achiu thap thei chu an hu ni kan tha chiang a he no pang ho ang achiu thap abscess nei mi lovin infectious mi lovin vein hu sak thap chiu ani chiu thi khatiang te kha an omani chu van availability accessibility sang ni availability accessibility a om to chon no pang jong hi pastor chung ko phai ni ta ka chon an hi mem le ti khangai to tham ni chu vai kan nau te he lai de hleka om te tan phei chon a him lo ra thak peer pressure hi ni ta peer orientation mobile phone orientation social media orientation peer pressure kami ang zong kha peer attachment han ne kung song pathum song palia chuan den khata tang khan eng man lo zero pressure sang chona le ti te khatiang kha experimentation a te khan social culture norms mezial te pe chu kan lo ngai lap tlang puita alo zo ve ni kan ti meita tlem sang deu ti chon ba poi ve ani le atiang khan kan social culture norms sar jir khan thosi tamna deu chon alo zu ve bor poi mi hen ti ma se kha khatiang tang khan kan ngai zam lo te beer te chu poi le ne mo wine khatiang khan thil reng kha kan social culture kan norms normal kan ti kha ti ringot boy normal ti ringot boy zir thamani tu ngai no mani khami khan min lo influence na sa the ya drugs can use not an experimentation a po hian no pang khan apoi vak lawanga ti te apoi ati te ma se poi taksi kha o mani psychological factors hi asang khop mai trauma no pan lai abuse violence khami age ka kan siam adverse childhood experience kami ha kan thate more scale te kha psychology te le social work department lampang kha chon tlem in thade in ka ringa hemi adversity no pan lai adversity nei na sa ho chu addiction shima le nat dang autoimmune disease anga te tin thil sang diabetic khatiang obesity kan ti anga te po hian an prone bi kan ti ang chi vulnerability kha omani e poni se kami psychological factors self medication lampang te pon yang chu mo karilui ha makain ti chuan an nuam deuh huai dawn an tia chu experimentation kha alo oma then chu da tang chuan occasional irregular use ani chu ti zeu kartin thakata voi khat te mo kar khata voi khat weekend apiang te mo birthday party Christmas khatiang khan lo ni chole ta hey hi chu occasional hi chu depends on the initial experience ati tani experience atira experiment hey drugs ti na zong hi an addict vek lo ani kan experiment zong na addict vek lo ti hi chu kan chian chu apoi mo khop maya achan chu kha genetic factors te vulnerability risk ti te khang kha atam ezir ngai nom lu du ka omani achan chu tun antinan heroin the number 4 opiate te hi mi so ma hian experiment ta theu se pani ba ki der thong addiction na der thong tak tak an omno chu chon experiment na poilo ka thi na lampang ka soina ni lovin ani na chuan an voi khat experiment kha apoi moni pan ti le hlan kha ti le hun kha an chang ran to mi abak te chu an nuam kho bolom tu kan the hin le mai chen te pe chu kalwa ka chu kan nuam lo eng ti na mani lo mo an ti zui chuang lo kha ni chu wangin a risk domain a ombik physically environmentally socially khatianga a risk kha chon om so first experimentation khan a second a use na tu ra kha occasional a man da na kha ril em bokani ti kha ani ta ti chuan regular use a khan om ta heta hi chon atan misuse ani to a man a vain in chunga a na emo a le khazira emo hau emo bahla emo anei to ni mo chuan symptoms of harm start appearing at the time heta hi chon regular use a chon a taksa ani mei theya a na ani mei theya social life ani mei theya khata khan harm kha lo lang to thin chuan dependency addiction ti khan tani ole ti khan hey tobacco le alcohol kan ti ta tobacco big takin hey gateway drugs kan ti chuni tani hemi at gateway theory hi chon hemi na nicotine drugs nicotine ani emo hemi enge vapor kan ti mi kha vape na mo tu na electric cigarette kan ti ang chi te ai polo ni se khang kha nicotine ni ta khang kha cigarette a nicotine na om ta chu chuan heta kan thuak ka kan limbic system a nuam hriat na lai kha a khoi ve pleasure center kha khoi ve ka ni chu po chu topic khan lian ta ka ni eng po ni sem chu ein link vek ri thil thing phim kha in link vek ka chun atlema langnal mei thei ni lo langnal mei thei chiat na rup thleng lo ni ma se tobacco khan ma se a pleasure center kha a han enge stimulate ve a chu wang chuan khami kha ti to chon a le pek wheat ta emo alcohol la emo a kai san kha enge likely ani chu a propensity kha sang ani chu chuan ta chuan hei charas ganja kan han ti ta tin ke tuna kan enkol lai kan naute tambera chon volatile solvent kan ti inhalant kan tiang chi then right ho kha then right boy zu anga effect de lek han ti mi relax de huai ma se thil mu le hei ngai tuana anga chen theina ang chi khani ta ritual thei bad trip lawa chuan an enjoy ve view thi la rei lo alcohol lampang rui nen hian klemein an na deu ani boni se kha a gateway drugs soft tangin ti khali ta ma se tun lai trend chu amak lutuk kan naute bi ka chon a population chu an claim mei thei ta ke ni chu a severe case ron lut thin ani ta in enkol na kan ti kha zial zumia lo in chiu hal pop anom so chu ani no taka chon hemi a theory le findings tam taka chu study a chon ani lo ani street children sa po ani lo ta ma se Mizoram ma chon khatiang sidan kha om tatani a chan chu apai na zuar miawa zuan zuara an vol trina the an background na cheboka emponi se thalam pa chu thosan ta se khatia a hard drugs a po injecting a han lun hal pop mai kha chu arrest kha san tur si chu no pang ne bok thuak nem bok information la dong claim box HIV chung changa te le thil sang health issues thil dang trim ma po khang kha ani okay hun hiang sa la nei
Another 10 minutes, sir. So, and I think so. We have to use bilingual, right? Even English we'll be using, okay? And then 10 minutes we'll need to after that Q&A.
Q&A, okay.
At the end, we will have Q&A.
chuan okay mizo tong khan kan lo soi chhozela polisela age factor severity of problem. So now we'll be talking about the severity of problem. Here are some problems that the factors that are listed here are age. So the onset or experimentation or the first initial use of drugs if it is under 18, because the brain is still developing. So the problem of getting into the tendency of getting, the likelihood of getting into addiction is high, very high. Age factors ka o money. Then, so if we look at our case study in our institution, we have half of our inmates are IDU, and from that IDU population, 33% are HIV positive. So there's a chance of getting into addiction plus infecting HIV/AIDS. So age factor lian lutuk kanita. So it is a very important factors. So and also when you cross 50, the problem, there will be another problem. More aging ka ati chakle dona nechu. You start aging more quickly if you use alcohol or any kind of drugs. Kakanita severity of problem. So age is a big factor. Nutrition status and living conditions. Nutrition status. So the problem or the ill effects of drugs depends on your health conditions. Okay, the health conditions prior to the abuse. So hey, premature anga piang te emo no panlai rim anilopon. If your mother is under a very stressful condition during the pregnancy, malnutrition te, then malnutrition emo kami poverty, the poverty and addiction, abuse and the ill effects are ein link nasani chu. So poverty chuan ele into the nutritious food ai thei don lo ta, then immune system te lo ta niam lo thei lo wanga tiang kha ni ta. So genetic loading factors ka le ta, genetic loading factors. It depends on the problem, and the severity of the problem also depends on the genetic loading factors. When we talk about genetics, it is, of course, there's a study and findings regarding the predispositions of certain genes which are risk for addiction. But when we talk about predisposition, it is not predeterminant. A predeterminant ani lo ni ti at pa po zungil venia anu po chutiang khatiang chunia atia grandparent hemi in tha chon mo heredity khatianga wang khan ani hi addict nge yang ti kha ani lawani. So it's not predeterminant. So there is a predisposition khachu oma. Okay, then khalaya kha country chian apoy mo boga chuan a genetic ama khan, if there is a vulnerability or risk in a genetic factor in a DNA, then he is or she is likely to get addicted to drugs. Then the problem will be there. So alonita okay. So there are medical and psychiatric complications. So these are the medical and psychiatric complications. Okay, so I'll just go through it, try to be quick. Problem due to intoxication. Intoxication, when you are intoxicated, your perceptions, your hearing, all your sensory will become blunt. Your especially when you due to the intake of cannabis and alcohol, it will have a slow motor functions. Your mood will be mood swing in a so problem due to intoxications, all the accidents, road accidents te violent kan han tiang chi in sual ang chi te road fight gang fight kan tiang chi zong zong ang chi khap in rui awanga lo thleng ani ti kha ani ta problem due to withdrawal kha om velea okay. Here, the problem due to intoxication is trauma and other physical injury. Oh, then perceptual distortion. Anti non step ate local ta muampur ang chite kong bumbo po muampur ang chi khatiang perceptual distortion ang chite. LSD emo cannabis emo irui chuan khang hey emo mushroom kan han tiang chi khami hallucinogen kan han tiang chi ra reng roi chon mani hi om talowa in thriat na lubung lu te po bung taklat anga in thriat nang chi te mo khatiang chi te kha a om the ni chu mo chung zong zong a kha a om the ya chuan rui lut tu ka wanga cha thak odi overdose death khami zong zong koma te khang zong zong kha a om the. So these are the problems due to overdose deaths ti hi chu. I think it's self-explanatory. Here kan da zela problem due to withdrawal, depression achuan excitation kha omani withdrawal effect achuan. Chuan stimulant achuan withdrawal lethargy zoi ngoi na ni tam tak an mua met ngol vei te po kar khat chung te an mutop mai an withdraw chuan. So intense craving kha om ta ni craving lai tak hi an ne lo thin. Oh chu ni chak em na ko chak satlia me ni lo chak ngoi na angkha anita withdrawal a chuan chu ti addict to te po ani bokani mo a chance at a mile da chuan anxiety te ron set in thea depression panic khatiang chi zong kha can be very mild but it can lead to severe symptoms khan ar om theini chu chuan hemi pialam han acute withdrawal symptoms kan ti pialam han post acute withdrawal symptoms san ti ta post acute depression che an hedonia te thil ang kim mai kha thil nuam lo hre om ti a enge thing dup anga hriat na khovel rim ma kha sad top chu ti ang din mula chuan tin hemi zu a chuan kan hrianga especially in alcohol the acute withdrawal symptoms like delirium tremens, Sarkov-Kornikov anti-may, hemi memory lost, then it can be fatal also. Then shivering, seizure, ang tetling kan withdrawal. Then psychiatric disorders associated with substance abuse. So psychomotor disturbance, disorientations, a person will not know what place, time, the date, the day, the person, he might not be able to recognize the person. Disorientation psychiatric. It can be temporary and it can be permanent also. So idea of reference stage to schizophrenia, psychosis, this is a bit psychotic. More psychosis lampang harsapna anita me tu tenemo real tat titlat soichia le newspaper ate makhatinga ti thalodo na triatlat nang chi cannabis ate hallucinogen ate hen dotin baka alcohol a po chutiang chuan a theini. Okay, persecutory delusions is that tu tenemo peer ru mo tu tenemo peer ru a that don tlatai riat nang chi te emotional response thil lungai thlak de po nui huwa mai nui reng mai mo soi reng mai ang chi te khatiang akha om tani. So often it can cause a problem to the skin's acne mo khang te then cardiovascular thok kan thok na kan thisen zam kan thok na dot te kan lung pam na te tin kan thin kan liver fatty liver the cirrhosis te khang kha thlen theya reproductive system khatlen theni drugs awang dika wangin sex workers ate po om thei pha ta ni mo chung te po chu then STI HIV akai pha thei chung te chu ni ta tin libido kha tin hiam thei ni tam tak chung sex performance ka enhance thei do na riat na ne ma se ani lo ani ati ngiam so ka ni ti te po kha riat a thakop maya tin kan endocrine kan thyroid te khami gland sang le kan organs te system kha khoi a effect boka gastrointestinal kan digestive system te khoya complication HIV te khami nil syringe thiang him lo in exchange atang khan abscess le khatin zong kha a thleng thei boka ni okay khang ho kha atlang we ha soi thei chunia chuan question and now will be a time for question and Q&A mo chuan hei Dr. Ru te pon on thlenga medical tha
So, hey.
Ngari mi lo khami kha
Allow me. Wireless. Okay, let me use. Okay, please. Thank you, Dr. Zara. So, very informative. We had a 35 minutes, lecture. We were listening his lecture, okay? Mainly on the concept of drugs use, drugs use, and then the types of drug users, the symptoms, then the magnitude of the problem as well as the severity of the problem, then the risk factors, like the social factors, hereditary factors, genetic factors, then medical and psychiatric factors. As well, he also spoke about the withdrawals, right? So it's really comprehensive to have a knowledge regarding drugs use, the ill effects of drugs use, okay? So regarding his lecture, I think so we should have a brief Q&A. Or a brief Q&A. If you people have any queries based on his lecture, so you are most welcome so that he could reply immediately on the spot. So anin niti na puzara na sa Dr. Zara ron soitak ang kanin hey toifil takin kim takin aron soyani type symptoms te a severity te a risks a vulnerabilities te withdrawals te and then so it's really informative because I believe so you people must be unmarried, right? Most of you. So we have to think about your reproductive health. And then low birth weight, premature birth. See, all these informations are important for you to know because you could pass it on. You could be an ambassador to other people to give this information. Midang te in shil sheve the ni so in tian te mo chu wang chuan Q&A toy te kan honga zona kan nei ang kha in thlasung lawin kan zo tanga mizo tong pan a zo thei ve kan ya engma I enge kha za thla ka om law okay so we will have a brief Q&A in zo tan theyang tunge zo tang zo du nei mic an lo peng chau please
Hi, sir. Mizoram ka zot tanga apoy lo chu. Tuna kan ya lecture at mi chia kha ni lawa amai ro chu session dang topic hi ka ena tun hi azo hun tak ne ka riat wangin karon din pui duwa chu hey tuna kan lecture ngai thak le hemi kan topic hi Mizoram bi ka thalaya ka thil ngai poimo le ka ngai serious mania ke ma po hianin ka subject le hemi ka englo concern hi chu ni lo na hian ka zirve na sa ni chu wang chuan zo ka du na chan chu ania a impact le affectors te a stages kha kan zirta a thil tangkai tak ania chuti rual ero chon hei voina rongkal hi university students mun thuma thena mun khat pokan tling lo ni asoi chonang chi te khang ang kha chu thil tha tak ani thowa kan ti tur ania amaro chu society ya kan role play ve thei khang ang sang hemi adang hi chu HIV AIDS ti te ni to hloma abikin drugs bi ka khan enge kan ti ve thei kan bula om te kan chung te emo kan unau te emo I kan thian tha te emo kan hnai vai mi te pa ka kan society a khang sang kan zirba ka khan eng role nge kan play ve thei ti ka hrecha ka ingai da na kha chu entirnan society kan thianga Mizoram a hianin chu Mizoram a chuan workshop ang chi te seminar ang chi chu kan nei ngun ani hem tiang isu a hian amai ro chu a effectiveness a hi te taila asang lo rio riat nei ka neya chu ta chuan engtin nge enge kan ti ve thei ti lai taka kha ka zo tu che ingai dan min chang thei chi alo ni pon nakina personal de pon min hril thei chuan
ole aron changang zona dang alo mem o zona dang kan nei chuan lo in ring ula chumi chungin sarzaran tunami kha lo chang lok se
role hemi duna chuan a chu tiangin ka ngai dan khani me don ta karon sei tu heta nakin zela po kan nuarung kal tu tele kan miste kan sa te pon tam tak sei tu ran nei me thea poni sela hey academician in na angin hemi drugs luar zela hi chuan ke mani kan in educate kan in equip hi ngai khop me chu in ti tho to poni karinga ill effects kan han tiang chi te addiction a thlen thei nang chi te mo addiction lai tak ke kan zu thra thiam chia lo dewani ma se addiction kan ti chu angol veina lai kha azura thak sia khatiang angte zuzir chianga zuzir tir ve thei tura ma ani le kha thiam te ni wang in equip kha poi mo chu no pangte te po simple de win aliana po tiang khan hre thiam thei dan tu tok zelin tin role model hi kan mamo at u de en ton tur thil thati tlat mei ko than bel tlat mei wai mei mong tlat mei te thu tha to kam tha zir tir emon nung changa lan tir the hi kan thalai big te kan mi pa te pon kan mamo a khami tan khan khadiang khan ni sela poi mo khop maya tin kan veng chua mo zoro ma nge po han an en tai la drugs ati rui the thilai ai toxicant lai intoxicating lai rui ti hi kan le dan poni tani ma se rui the thil hian enge apek a relax mo ti ang chi te ati dam doi ania engmo chen chu painkiller ania anna te a chokolom mo a stress te relief alom khalai akhan zuen chik le zual thi ngai mo ka tia why the pain engwang nge painkiller amamo engwang nge a stress relief amamo ti lai kha khang temporary tak addict thei ni thosi khang ati nge alo ban ve mai ne aban na chan zo ka kha enge niang a chung ri la khan eng nge hliam anei mi hidden stress te neim mo anin chung khur kha enge ni ti te khalai kha kan zulu thil thuk deu hi chu angai em o ka tia ni china kan se khan adverse childhood experience te ka han tiang mo mi so ma khan an vai na ne dik lo experimentation ti kha experiment kha tha ti na ni lo vena ama chu engwa experiment atin attend ka engwa addict ta nge khalai khan a social environmental issue le problem ma khan zu ti the kan ne engem kan veng chu nga te tura kan nau te rong kal te chu ani na ta ka chon economically mo socially backward deute khatiang te khan ni ta ni tin ril ru liam le chung ril lampang har satna psychological thil hi kai biru diten oma tiang khan nakina po olive lampang tang hei hi sum nei lo lampang te po ani bi ani chi alo mai the mo apo wati ngor lo po khan chu wang chuan ami hringa kha engwang nge hemi a hi tia zirna kan nei na sat kan nge vel chu ate malak akha ngai ta no pangzinga khan chu ni ta poni se a effective fak lo ka ti ro khan awareness no pangte zir ti kha effective reng thoni abak education hi mo kan nei lo ani ti lai kha chu kan soi tel do thil dang po tam tak om me ka ve zong a ron se pani chu a root cause ka wo
Actually, to get try alomom lutuk nya I soitong kan university pum hua pa han ne kha acha komin apoi mo hle a mai ro chu gan shat theu angin zerna thil kalmek ani wangin a howati avai vayati a har sa da wangin department tin rang iron kal khoma kan mo phuna chu kan department ate kan veng chu ate kan ko ate kan the da rangai ni sumo. As you know that it's very good to accommodate all the students, entire students of Mizoram University, but then however with certain constraints we have to do such kind of a program having representatives from all the departments of Mizoram University. So our responsibility out here is that you have to be you have to disseminate the information, spread the information amongst your classmates as well as within your family, within your society, within your church, or wherever is possible. That must be our take home. Okay? So thank you very much, Dr. Zara. I think so. Okay. So thank you very much. We shall now have a lunch break. Okay? Packed lunch break, a very short break. And then resume the session as soon as possible before 1 p.m. We have to resume. Kan chan le ngai o. Kan zo vat kan chan ma khanin timing dik taka kan bang thei dong ani. If we people are a bit casual, then which means it will affect our end session timing. Okay? Kan ne nga so ta registration in tin kan refreshment counter oma. Okay? Out there we can go for refreshment, lunch, and then get back before 1 p.m. in your own seats. Internet.
Hello. I think we should start the second session. Are they coming? Have you called the students? All right. We shall begin the second session of the seminar on HIV/AIDS, drugs, issues and challenges. Today we have with us Dr. Ruth Lalmoanpui. She's the Deputy Director, Directorate of Hospital and Medical Education, Government of Mizoram. She is also here in the capacity of the second senior most psychiatrist under the Directorate of Health Services, Government of Mizoram. So we are very lucky, dear students, to have with us a very prominent psychiatrist of Mizoram here with us to talk to us about the mental health issues of young people. She has had years of experience with different populations with regard to mental health. So today, if you have any queries related to mental health with regard to young people and the issues that you're trying to overcome or dealing with, so this is your chance today. So please pay attention. I would like to call our resource person to the stage, ma'am.
Thank you, Ms. Grace, and welcome all of you here to the second session. And okay. Oops. As mentioned, my topic today is mental health issues in young people. So I think we'll go bilingual if possible. Okay, mental health issues in young people. Here there are two things, mental health, young people. Okay, so first, what is mental health? What is mental? What do you think? What do you think mental is? Real she said. Real rule. In real rule. Where is your real rule? Can you point? Here or here? Here. Okay. Yeah. This is the brain. So when we say mental or when we say real rule she say real rule boy, what exactly do we mean? Real rule, what does it include? Any idea? When we say mental or real rule, what all does it include? What comes to your mind? Yeah? Real rule me. Ngay tua na, right? Thinking, okay? Ngay tua na. Thinking is one component of it. Any other? What comes to your mind when you talk about mental? When we just say mental, what comes to your mind? One is thinking. Ngay tua na nya, tuan. Any other things? Think of people with mental illness, if you know anyone, or if you have experienced mental problems, what happens to you? What are the problems that you face? What faculty is included? Okay. Just think about people with mental illness, severe mental illness like psychosis. Okay, what is impaired? Have you ever thought of it? Okay, first is thinking, okay, the cognitive part. Thinking is there, what else? Judgment is impaired, right? You see people with mental illness, severe mental illness, psychotic, singing in the streets, talking without, when it's not the time. Like the judgment is impaired, okay? Because they don't know what to say, when to say, how to act. It becomes inappropriate. Okay, they dance in the street, they sing in the street, so their judgment is impaired, right? So mental means judgment. Anita, what else? Memories. Okay? Okay? It's included in everything. So your memories are included. More. What else can you think? Emotions, very good. Yeah? Emotions is the one of the important component. Okay, emotions. Sad, anger, right? Happiness, jealousy, everything. All the emotions, positive, negative. Your emotions are included. What else? Thought process, very good. Okay, your abstraction, your imagination. Okay, everything. All the thought processes are included. Okay, your calculation, abstract thinking, all this. Any other? Perception. Okay, I think someone said perception. Yeah, perception. What you perceive. Okay, how many senses do we have? 5, right? Eye, ear. Okay, we know all that. 5, all those perception, what we see, what we hear, what we taste, everything. Okay, those perceptions are part of the mind, real rule. Okay, so when a psychotic patients have hallucinations, what is the problem? Okay, he sees things, visual hallucination. He sees things which are not there. He hears voices which are not there. Okay, without any external stimuli. So the perception is also included. They taste something which is not there. They smell something which is not there. All those psychotic symptoms is because the perceptions are impaired. Okay? Anything else? Okay, those are the main components of when we say mind, when we say real rule, those things have to be in our mind. Okay? So mental health, when we talk about mental health, those things have to be healthy. Okay? And when we talk about mental disorder or mental illness, those things are impaired. Okay, you understand that, no? So today our main issue is mental health issues. So we're going to talk more about mental health. Okay, this if you Google mental health, you will get many definitions, but this is one of the main definitions that we use, which is mental health is a state of mental well-being in which an individual realizes his or her own potential, is able to cope with stresses of life, is able to work fruitfully and contribute to his or her community. This is the WHO definition of mental health. Okay, so there are many things. State of mental well-being. Mental well-being. Nun nuam, nun hadam. Okay, what exactly do we mean by a state of well-being? Hati nun nuam hadam kan hanti chuan engenyang. Does it mean that we should always be happy? We should always smile? No problems? No. Okay, what mental well-being actually means is being positive, being able to see things from different perspective. Oh, til shang shanga kong shang shanga til tiam te being positive. It's not that you should always be happy, you should not be hurt, you should not be angry, but whatever circumstances, whatever emotions that you may initially feel, how you carry on with that, and that is going to define your mental health. Okay, we'll talk about that later. And realizes his or her own potential. Okay, kan ni na insha tian na. Okay, ni na insha tian na hipoi mo alu to kani. Am I male, female? What is my talent? What is my capacity? Mo enge ka thei na, enge ka tui na, enge pathian hian khovela hian min da ve chan, enge entitur hian nge kong. Our capacity is not the same. Okay, our talents are not the same. So, depending on how we know our talents, how we know ourselves, how we know our potential, that is going to lead us in everything, relationships, jobs, okay, studies, everything. It's going to determine that. kan che thiam tiro kan ni na kha kan in shia chia na ngai ni eng hinge ka tui zong eng talent nge kan nei khoi hinge ka kal na tu mi na tha an ti ang ringo tinge ka kal don ke mai na ka in en chia na ka in shia chia na ka tui na zong ka kal pui don ka value system a po eng hinge ka du zong eng hinge ka ma chop tur khalai kha kan in shia chia na ngai ani relationship a po poi mo tho chia na po poi mo mi ngai zong nu pui pasal thlenga hi kan shia da poi mo ke mani kan in shia chian lo chuan midang kha engani midang kha chu kan va she chiang don lo wa amar chu relationship a po kamizia mil pui te mo khang te ang te kha kan in shia chian na ngai ni kan mizia engkim kha and is able to cope with stresses of life. Okay, this we know. We'll talk about it later. And is able to work fruitfully and contributes to his or her community. It's just not working. Oh, it's just not studying. It's fruitfully. To work fruitfully. What am I doing here? What am I studying for? What am I working for? Is it producing fruits? That is what the mental health is. Okay? Not just going along with the crowd. Maseti tak zatin ra kong til kima ra chu kan chwa thai kher lo me thei ma se ra chwa torin thil ka ti em kha khan ken tel atam anga em ani and contributes to his or her community. Midang tan amal som na ni na midang tan enge ka tang kai ma tan cho mi mental health han ma ni cho hi a khoi thai a en thai lo reng okay, it has to bear fruits. It has to go out somewhere to the community. So bang chon mental health kan yong keima chan na tur chau keima lo tin na tur chau keima ta na chatur chau kha en thei lo reng mental health chung tiang anga chon mental health in nei ngai lawang and it's going to produce negative effect on you later. So whatever I'm studying, whatever I'm working for, it has to be for others. It has to be for me as well as for others. Mo kaka mental health asoy fia na choni. Apathian thu tero. Pathian thu ne han kop do na mental health so. Mo cho wang chuanin kaka kai mani kanin en fia nan po apoi mo tani. So next is what is mental disorder. Mental disorder is a different thing. It's a clinically significant disturbance in individuals' cognition, emotional regulation and behavior and behavior. It's not or and behavior. More to all the components ka cognition is thinking. When we say cognition, it means thinking. More individuals cognition, emotional te behavior. That if there is impairment in all this emotional component or cognition, there will be impairment in behavior, and that's how it comes out, and that's how the mental illness, the symptoms come out. That's how we know that the person is having a mental problem. And distress or impairment in functioning. There has to be some amount of, if not complete impairment, there has to be some amount of impairment in functioning, social functioning, personal functioning, okay, or occupational functioning, all those functioning, it has to be impaired. Unless it is impaired, we don't call it a mental disorder or mental illness. Depression, kariru ha vyao mei thei, ka depressed vyao mei thei. I may be very depressed, I may be very sad. Okay, but just being sad is not depression. Okay, it's not an illness. You may be depressed, but you're not having depressive disorder. Okay, you know the difference, right? You may be having anxiety, you may be very fearful, but you are not having an anxiety disorder. Okay, unless it causes some impairment, we don't call it a disorder. So in 2019, according to WHO, every 8 people live with a mental disorder. Okay, and in 2020, as we all know, because of the pandemic, anxiety, depression is shooting up. Okay, so that is a little about mental disorder. And I'm not going into detail about the mental disorder. If there's any question, we can ask. I'll talk shortly about the disorders. But since our topic is mental health issues, we're going more towards mental health. Okay, and today I'm not going to present any scientific papers. Okay, scientific things. More academician in ron soi viau tu chu ni na in amara chu at engeni thil paper mo khatang scientific thil kha karon soi don lowa I'm going to base my presentation on my experience and the experience of that I have here in Mizoram, among the youths of Mizoram. So it's not going to be any scientific paper or any facts and figures on all those things, okay, except a few things from things about adolescent or young people. Another thing is young people. The topic is young people. I don't know what young people actually means. If you go by WHO definition, 10 to 19 is adolescents, so I go more with the adolescents. But if you go according to the KTP or something, it's up to 40, so I think you're all included in that. Okay, so whatever will include till 40 or what adolescent or whatever, okay, whatever you want. Okay, before I go into that, just 2 points about our brain, adolescent brain, okay? Use it or lose it. You know what this means? Okay, our brain, our brain, these are 2 pictures of the brain. I don't know if you can see it properly. There are 2 facts I want to say about adolescent brain, our brain development. One is that our brain, you have heard about neuroplasticity? Yeah, neuroplasticity, okay? The nerves, our brain is composed of billions of nerves communicating with one another, okay? They're just sending messages, whatever messages we feed, it keeps on sending messages, and it's always sending messages, okay? And the nerves in our brain, they are not static. They are not just lying there, okay? It either multiplies or it dies away, okay? That is called neuroplasticity. Okay, when we are born, the brain nerves are there, and it keeps on increasing till about 6 years old, okay? Ron pung na sa ni ka nerve himo, nerve brain na nerve cells, nerves how he. Aron pung chauta, to vanya kumruk ma atil kan zirle kan til shia ta hi anghet Katilaya kan man le man lo hi apoy mo tani. Whatever nerves that are not used, it dies away slowly. That is called pruning, okay? Pruning. For example, maybe you have a talent in music, okay, from birth, genetically, okay. There was a brain, the area in your brain where the music talent was there, but you never used it. You never used it. Mangai me alone the music zir ngai lawa lekha pai chia ngani zai pai zai ngai lawa. You never used it. So what happens to that? It dies away. It says, okay, my master or my mistress is not using me, so I'm fading away. Oh, above me. That's called pruning. Whatever nerve cells which send message regularly, they will be hardwired. They will increase, they will be hardwired, and that is your memory. Okay, that is a part of your memory. So that will keep on increasing, that will be hardwired, and then it will increase, and then that is very important. Okay, the other things which you don't use, they die away, that is called pruning. Mo hey, kan mer shiat te po kan no pan lai mo class 1 class 2 vel kan ho to lo ren hi chu an mel po kan theng hil me te ro mo kan thil shiat tam ta ki kan sharing lo ni memory zong zong to sai don la thui don amero to that is a very important thing. And then after that it keeps on like after pruning occurs, those that are not used, they die off, but the ones that are used, they keep on increasing. And one theory is that during adolescence, this neuroplasticity increased again. Sometimes they call it a second chance, okay? Second chance of learning things. So that is very important, okay? That is one thing in adolescent brain. And another thing is that our brains don't mature equally at the same time, okay? They don't mature at the same time. You know the brain, there are different parts, they don't mature at the same time. Just 2 things. One is the green area. If you see the green area there, that is called the limbic system, okay? The limbic system, reward circuit, limbic system. This is the emotional center where all our emotions come, okay? As well as the memories. Okay, we'll talk about that later a little. Okay, the limbic system, it matures during adolescence. Early adolescence, it matures. But the other thing which is very important, the prefrontal cortex, the one on the front, ki het ilam sting lo kan na mo pointer ka. Okay, hey headline. Hey, kan salami headline the frontal area. Okay, the frontal area. This is called the frontal lobe. This is the thinking area. Okay, where all your judgment, all the mental things that we talked about, higher mental functions, they are all here in the frontal lobe, and that matures only around 23, 24, 25 years of age. Okay, so that is very important because why in adolescence are we not able to control our impulse? Why are we so impulsive? Why are we so emotional? Or because the emotion center is already mature, but the prefrontal cortex, the frontal cortex, which have to control the emotions, they are not very mature. Kan siya tiya mem helai low control tu ka kan emotion te kan ngai to na thui zok min lo siam sak tu tur ka ala puitling tok la puitling lo ti kha puitling lo ti khan kan mang thei lo ti na ni lawa ala puitling tok lo ni chuan chuan emotion ron puitling to si hetilai ron eng lo tu la puitling tok lo hianin tlei ro la hian thil ti chak na control thei lon the drugs kan so ya retail sex and kim heta puberty, we all know about puberty. Okay, all the sexual hormones and everything, they come up. But this is not fully matured. I'm not saying it's not mature. It's not working, but it's not fully matured. So that there lies the problem with adolescents. Okay, but this doesn't mean that adolescents cannot control themselves. Mind you, okay, you can. But they need constant supervision, constant telling again. Okay, just once, it doesn't make much sense. Okay, kan thunun, they roll how kan zinga ka soichuan, kalai ta ka nu le pa tho kan oi na te zirtir tu tho kan oi, atu na lai chu kha khani. More, it's not that they cannot, but sometimes they have difficulty. We can keep on going about that, but I'll stop there. Key facts about adolescent young people mental health. Globally, 1 in 7 10 to 19-year-old experience mental disorder, accounting for about 13% of global burden of diseases. Depression, anxiety, behavioral disorders are the common leading causes of illness and disability. And suicide is the 4th leading cause of death among 15 to 29 years old. This is the WHO figure. And this is very important. The consequence of failing to address adolescent mental health conditions extend to adulthood, requiring both physical and mental health, impairing both physical and mental health, and limit opportunities to lead a full life as an adult. So adolescent mental health problem is very important, but because, as we all know, this is going to impair their future. This is going to affect their future. So this is very important for all of us. Okay, determinants of mental health. Okay, there are many determinants of mental health, but we're going to highlight just 4. One is healthy sleep pattern. Believe it or not, I don't know what your sleeping habits are, but healthy sleep pattern is one of the very important components of mental health. Number two, exercise. Developing coping skills, very important, and protective and supportive environment, family, school, community. Okay. I'm not going into detail in all this, but I just want to highlight just one thing, healthy sleep pattern. Why is this important? Why is this important for mental health? Okay? So here, another brain. Sleep, as we all know, is very important. Why? Because it's a time when the mind has to reset or recharge. Okay? When our mind has to reset, every battery recharge recharge hun khani in siam chat hun khani kan mut hun he chuan poor or insufficient sleep increase negative emotional response and decrease positive emotions kan siam tu rozan kan mut chat lo chuan engting e kan om chen kan mut chuak engzang ye mut chuak che tu na khan kan mut te chuak ka chu lo nge kan thing te chia tu ro we tend to get very angry, the little stress, then we mo tru anem in shian ne te kha boy thinem thil te kha in shila win hai hot big do te in shiam in mu chat lo chuan khang kha a problem ani ta ni negative emotions ka engani increase engatinge he kan ti chuan during sleep memories emotions and new information are processed and filed to be retrieved later in mudlan khan thil in thua khian thil tam tak alo ti ni mi lenga in thil don sonaha in memory te emotion te whatever information that you got during the day it is going to process it at night file some for later or whatever so wang chuan in mut hi in memory tan po ngatinge exam don hianin mu tharawan ti 14 tiro in she 14 ang tiro engatinge zan in mudla hianin pakhada. So there are many functions that the brain does during sleep, but I'm not going to talk about that. Only two. I'm going to talk only about two processes or two functions that the brain does while you're sleeping. Okay. Again, sleep cycle po so ito thaya masa hun englo sia kan mudlan hian pakhatna chuan kan ngai to na le kan information song kha alo processor alo store ani khami kha in mut that lo chuan ati theilo ati buai vek in mut lo te tlai war te hemi han khap process kha ati buai ani chu wang chuan zinga te khan in han haranga chiang lo de concentration te memory te ti buai ani chuan thilin han ngai to po ri ru film lo ani achan chu khami wang kha ani ta ni tin emotions po chu khami ti tu kha enge amygdala kan tia mi diagram ki han anila ke so mood sleep how you sleep anita ni this diagram that I showed here this is what happens again the sleep process like we say like here hey amit ta changin light kha lo ta omta light kha kan mit hianin amu chung hi chuan kha hetilai hypothalamus kan tia hypothalamus hi it is the angani a call bearing itani kan mudna khan it is the center for we can say sleep okay hypothalamus omta hypothalamus hianin engeni nucleus pakhada oma chumi chuanin tikhan na athok zela melatonin kan shiatro athim vele khan khwa eng kan hu lo hian hemi hypothalamus atanga mitin kho eng hu to lo hianin helai pineal gland kan te helai gland te ro ten hena hian message thona athim ta e ti asha vele khan melatonin hi chu hormone pakhathi aron ti chuak ta chu chuan kan mu chuak asan tel khanin kan mut kha lo chuak ta china ni kha melatonin kha chuan jinga lo enga en kha chuan light a mole khan kha melatonin production kha atop ta ni chuwang chuan chuna khanin kan alert ta ni khangtang khani chuan hetilai hianin a process poima de chu amygdala hi khilai amasazok okay anyway amygdala te khilai khan ma chu emotional center ni ta ni chuan prefrontal cortex ni china kan soya reason khami response khami connection hi emotion le khami he tilaya prefrontal cortex khami low process to kha khami pathway kha kan muthat lo chuan abuai tlat anin ti tha theilo communication anin thon tha theilo chu wang chuan muthat kha appointment quality of sleep is important quantity of sleep is also important mo chuan ho adang le chu hormone ati boini there is if you don't sleep properly there is hormone disruptions hormone to kan shia tro all the chemicals that does most of the thyroid hormone kan shia growth hormone kan shia parathyroid hormone mo khang tang song pituitary hormone khang song kha kan shia ni khang hormone te kha hypothalamus hen regulator engeni a secretion te mammo angazir khanin hypothalamus khan hormone ati chhuakani kha sleep achat lo chuan he secretion hi a imbalance hormone secretion hi a imbalance in chan he hi zana athokani zana kan mudlan khana thokani in chan hon he engteng eng siam growth hormone secrete tamber hi in mudlai growth hormone a tho hun po hi in mudlai ani mut chat kha poi mani tlero lai phei chuan mo chuwang chuan kha hormone secretion tam takan taksa na thok zong kha ati imbalance ya hi ati boai ta ni chung zinga pakhatsa karon highlight do chu cortisol hi. You've heard of cortisol. It is a stress hormone. Whenever we are stressed, when we are stressed, it's not just that we are stressed. Okay, it affects the whole body because there are stress hormones, adrenaline, noradrenaline, and another important thing is cortisol. Hence, stress hormone, he can stress one, it increases the production, and this affects our body. That is the body and mind connection between the body and mind. It works through the hormone. Oh, kami hormone ang thotor ay nasa chuani taksa function tam takan BP tisanga zunthum, blood sugar, BP, skin, GI tract. Every function of our body is impaired. Chuwang chuanin, apik taking cortisol hi han enula kilaya kan. Less sleep, okay? What happens? It increases cortisol. It imbalances the cortisol, and that causes stress. And when you are stressed, there is again another increase of cortisol, okay? And this keeps the body alert, and you cannot sleep. Okay, it goes in cycle. Kan siya tiyam stress le muthei lo hi akal kop na chanju a hormone secretion hi pakhat. One factor is the secretion of hormone, cortisol stress hormone. Kan siya tiyam chu bang muthi. If this keeps on going, since adolescent, if you have problem, okay, there are many factors regarding sleep. We're not going to talk about that. But if you don't sleep properly since childhood or adolescence, what happens? The neuroplasticity ni tina kan soibok ka. Kami habit ka inform tani. A habit inform chuan kami nerve ka no ni tina neuroplasticity at than nandona ka habit ka ron don habit chu engtin kan ti thana piang tuna kan soika kan ti thana piang kan ngai to thana piang kan soi thana piang mi kan hu thana piang kan ngai thak tama piang kan zir tama piang ka kan brain khanin message don tam kha chuan chu ni tina kan soi khan, it becomes hardwired. Everything that we see, that we hear, that we do, okay, that we think about, that we practice, everything, whatever we do, repeatedly that keeps, they keep sending more messages in the brain, so the nerves become hardwired and it becomes a habit. Insomnia itself is a mental disorder, but insomnia is a problem in almost all the mental disorders. Okay, so it is interlinked. So wang chuan tu na changa sleep habit, sleep pattern tha hi mental health tan hian apoi mo lu tu kani in le khazir na tan po apoi mo engkima tan khan apoi mo ani. Chuan adot le chuan stress in young people, there's so many stresses, as we all know. Adversity, many adversities, pressure, identity problem, media influence, gender norms, abuse, parenting styles, socioeconomic problem, and we can say a number of things. Who are at higher risk for mental illness? Those in humanitarian and fragile settings with chronic illness, autism spectrum disorder, intellectual disability, or any other developmental disabilities, pregnant adolescents, adolescent parents in early or forced marriage from minority, ethnic, or sexual or discriminated groups. Okay, this is very important. Okay, mental health issues among the Mizo youth kantiringota he hinichina ka soyang khanin khoilam journal mo article lam ka enlowa kema practice atanga kema experience atanga karon soi cho gatuma cho wang chan engma scientific a onglawa nya maro cho he kan ton na ne wangin he kan ran highlight do ni nichina han stress in young people kan tia khang singa khan eng poi mo kam ho dan le ke mani patients atanga kam ho to dan hi family hi it comes first. Chuan coping skills, another important, pressure le substance abuse so ni sida kan share ne kan ngai tha chau to ta kan soi don lawa adang hi chu okay there are others but not very important. So I'm just going to talk a little about all those 4 points. Okay, family ahian enge chungkwa poimo zia chu kan shaveka parental substance abuse hikada masabera parenting styles and their divorce or separation and abuse and neglect. I'm not going to talk about all of them. We'll just talk a little about the first 2. Okay, parental substance abuse hi aboy thak apoi hi ani to me main kan she to a tro ma khan enge ron soi chu kan shelawa amaro chu hemi ahianin he ka veve net achan chu tu na hianin ti hian ain thla chhong hi kan huna sa em ni kan practice a hian nu le pa abik takin nu le pa abik takin kan tilezel teng no ina ri thei thil ati hi apoi thui lu tuka hei hi ave om lu tuka kan ve vek karinga kan ve zel po ka du ni kan tam lo thei ke chu hei tuna chinan soyang khanin administration a ko om to tharuk vel ka om chawnia ama kum samni don kan lo practice to ta ka dam lo tiang ri thei thil ti mai cha ka mo pe hi chuanin counseling pon ni lo how hi ni rangot mai ni ka how na sa thei lu to ka ma se thanem ngai na tanga ni tian sha kha chuan thenin an hwa ma se ka poi ti chong lo ba chuan chuan hei hi kan ve yangai ni ri thei thil nu le pa fa te ang hong dan kan shevek soi tam po ngai chu chuanin mak deuh ka ti pakha chu ke mani mizowa hian hei tuna karon soyang khan engeni ang hong chu kan shiani family she om lu tu ka changa tiang ri thei thil family she om lu tu ka changa ron zi chuak ti meyang fa te an lo pui ti enga tinge o ka ta ri thei thil ti bok khian nei le chin ka shelo eng ma personal khan lo la lo la tu ma ka shelo chawa ma ro chu he him mak ka ti ni an experience to tang khan an mani pui ka ti china in experience to tang khan enga tinge in fa te hi hetiang bok ni tura tiang ang pasal nei sha shesa ri thei thil ti shesa hi in nei ka sha thiam thei lo ni amai ro chu kha kha enge ni factor tam tak chu om ka zo po hianin a om amai ro chu hi apoina takani achan chu atira tanga he entinan abik takin nu ina retate especially if the mother is abusing substance it is more harmful than I'm not saying that the husband should abuse substance but it is more harmful than husband abusing substance because abik takin fane line it that if there is a prenatal exposure to substance then the baby suffers from the very beginning. The baby suffers. Suffer lo thailo. Ngani pian swana some disability, mental ngani intellectual disability or physical deformity can be there. Mase kha po ni lo se an brain hi akhoi shim no pang hian. So chan englo bera difficult temperament. Difficult temperament. No te tap reng no te ni tang khanin en ko la har saringotini. So ta anno in heta lo abuse bok. Amain problem nei bok. No te in problem ron sample. Chuan enge problematic parenting. Parenting ka boy ta fekani. Parenting boy chuan afa ti khanin ni chhota insecure disorganized attachment. Chuan enge ron siam mental health issues ka annei du ani. Me a broken family mo ti ang family mi hi an thalo veke katini lo. Mo please don't misunderstand me. An thalo veke katini lo. Tak an ron chuak henga tang hian. Amai ro chu an mani po hian mental health problems hi an nei tho atam lu tu kan soi seng lo chu wang chuanin nau pangte ta changa kan han moi chu ri ru hi na thin mo no pangte ten ka thian ten school ka thian ten ipa chu adik minti anasin ipa chu inu chu adik minti homa om minti nau pangtang han mo an na lu tu primary level atang primary school level atang han no pang depression nei anxiety nei kan hunem lutuk he hian real road in na thina ni chu chuan enge mental no pang in a mental health problem nei chuan okay if a child has a mental health issues depression anxiety there can be depression anxiety in primary school level he chiang ro an nei lutuk okay they may not say I'm having depression I'm sad. Okay, but it shows in their behavior. Now, it shows in their behavior in childhood. So it can be externalizing symptoms, it can be internalizing symptoms, whatever the problem. Sometimes we just say, hey, no, pang to swallow. He's so difficult. He to swallow. No, pang swallow. He steals. He lies. He runs away from school. And kim kagan atin maybe conduct disorder. What is the root cause? The root cause is always the emotional. That is his way of saying, I'm stressed. I'm having problem. It can be a way of saying that. So khalaya kha helai a behavior so he can enter ni lawani china po puzara na soyang khan a chungril kha omazela ni khalaya kha so wang chuanin hi kan shia ta poimo a chemical zel kha mental health issues chuanin enga tinge ni china kan soy khan enga tinge ri thai thil ti bokin nei le thin question hi ani nasal tu kan the common answer is an insecure in chung anuam lo. Okay, home is very disruptive. they don't want to stay at home. Okay, parents divorce rate po kaya nga tamber chu substance abuse ni thau ta ni. Chuan in chungan wamlo chuan they want to get away from home. He a common answer ni tan. Chua in chung chua sanando. In chung chua sanando, so they get married to whoever comes first. Let me say. Well, I'm hoping for a better life, but they know that this person abuses, but whatever. They are forced. Many of them are forced to marry someone who abuses substance because of their family environment. Okay, the home atmosphere. So a cycle here so we need to put a stop to it. How do we do it? I don't know. What can be done? Prevention of substance abuse in children or substance abusing separated parents. Okay, parents so kanti danglam thei to labani me thei. Amaro so anfa te here they are at high risk group. If we can focus all our attention, if not all our attention, if we can focus especially on those children. Mo helai hi kangai poi mo lu to cho wang chuan ni china ron zona pakhata po khani enge mo zong hianin enge coping skills in zirtirte mo being there for someone, for the child. Mo no pang entinan kan chung kwa amo kan chen o ma mo tu te mo nu le pa rui thei thil ti fa te kan mo ani chuan kan let me speak in a personal term kan ti thei anga kha kan mo ani chuan kan chen om po ani thei a fa an fa anu le pa chu kan ti dang lam thei to lawani me thei an englo to ti dang lam tum lo tu ti na lam ni lovin amai ro chu kha cycle break tu chuan an fa te khan poi mo in ka sha an fa te tan hian enge kan ti theiang. Okay, so just being there he apoi mol to engwangin nge and research pakata engwangin nge hetam broken family de batang ron kal hi chatta kan ron sik so significant others psychology achang kan sheta manga significant others tu emami pakhat engeni an in ha thei na long mangai tu tlat significant others. It can be a family member, it can be a neighbor, it can be a teacher, more it can be a pastor or counselor, whatever. Tu emwa an nei chuan kha no pangkhani kha khan it takes them a long way. So wang chuan khami kha kan ni thayem kan chen oma tu mo kan shem kan va kom thayem kha no pangkha kan ina leng tu te I har sanai nei chuan ron soi ro min ron shil don ya someone to rely on kha khan man, someone to love them, maybe not as a parents love, but someone to love them, someone they can go to when they have a problem. Khang tiang kha kan ni thei chuan there is a chance of that child not abusing substance and leading a normal life. Mo kan chatya mem khatilai kha kan ti thei pakhanin ka chia tin hey a group ang demo, a club ang demo ka thu soi nai chong ka soi fo thina a community pilot project ang te po hian han nei tai la hemi veng chunga chung tiangan mem chumi te chu hey coping skills te kan soi hey psychologist tam tak kan neya hemi te hian han inzirtir bikila han ko bikila a general de wat ya soi hi chu thei tho engani no pang in coma te kan soya khang tang chi shang kha amaro chu focus big at least once a month we call them together. More those at high risk we call them together, we ask their problem, we share, more we teach them coping skills. Khang tang zong kan ti thei chuanin I think it will make a difference, at least in some of them, if not all of them. At least we can do something. Khang tang khan engemo big hemi veng big hemi clear big khang tang engemo pilot project ang de po han ti thei chuan khang no pang de kha can substance abuse so to can prevent. If we can prevent them from abusing substance right from childhood, I think it will make a difference. That is one suggestion. And another thing is we just said sex education, choosing the right partner. Partner ni lo cheu ta kan la ni me theya phim khurangai nya hemia hian choosing the right partner khapoi mo lutuk bokin ka sia. One mistake that we often make kan in nei chuan ri thei thil kan hayang zu kan hayang kan oi me tru kan in tu to chuan mi pa po hian bo mi pa me chia po abuse an tho kan in nei chuan min nei chuan kan oi me, but this doesn't happen practically po ilu to hi it doesn't happen practically. Most of them, I'm not saying 100%, mind you, mase atam zo ka hian hi antilaw chuan the partner becomes disillusioned thinrima chu chuan tilam so separation or what, all the other problems. So on choosing the right partner. I'm not saying you should look for a perfect partner. Okay, perfect kan umlaw. Amaro, so at least let them not abuse substance, if possible. Oh. Kakapoy mo bokin ka siya. So awareness kan itinahan kan soya. Awareness hi kan aho kan timate ya masi aho lo. It is one of the most ngani lapoy mo ber pakatso alan ni thawan hi awareness hi. A big takin hey tuna ke manipon kandam lo ten lo kala kanti po hiani in fact kanti to hi chuani anvai chu ni me alo mind you no ina fa ne po hianin uncare lo hi anani uncare lo amar chu care hin lo tho avai khan kan soi thilo khang hotel ne khan an fa te manga kati hi chuani anri ro hianin alud bekin ka sha chuwang chuan awareness hi chu kan lati zel tho chu angai ti kha kan soi du bok ani chuan adota chuan parenting styles is very important, but I'm not going to talk about authoritative, authoritarian, all those things. Khalam kha kangai poi mo, and I don't think any of you are parents at the moment, but you will be parents hopefully. Just a few things. Enge parenting style chaber engting kan fata kan en kolang there is no hard and fast rule. He shero lekabu po in lo siarangai may read many things. Those are guidelines. Once you have children, you're not going to follow all of them. Okay, so wang chuan apoy mo to know them, study them. Kan fati kan zir tia nangai, kan shia tia nangai, then all different. All kan shia tia le kabu ami hik apply ngot thailo. Tam taka chuan they are guidelines. Kati me ke mangai dan ni chu angani research based chu ni thau na ma se guidelines. Don't learn from them. Poy mo lutok. We have to learn from them, from what they say. Mani lo ka kafanu ni cho kumsam ni to enge mani kha kan soi sela kat ti swal lai cho isha mei men ran tia kat ti swal lai cho vi ron soi mei men ran tia mo kha tiang deu khan ya kha we tend to do that. No one is perfect, so we learn from them. Kha poi mo ni chuan be flexible, admit mistakes, can admit ve kha ngai ni chuan kan zirtir turani kan teach turani ya, and we have to be a model. Don't look for this in any book. The model ni kapoy mo lo tukani and don't aim for a perfect child. He can kalswa na fo. We want our child to be so perfect. We want them to follow whatever we say. It's not going to happen. So we have to be flexible. More, don't overprotect. Poy lo tuk overprotect he, but be there for them. More overprotect and kim dot lo tuk ha apoy ni na thoti ro na thohi. Lekazir chonilo na thotiri poi mo ani chuan don't be afraid of to discipline them. Discipline hi poi mo lutuka nu le patam tak ina min ran zo fo chu katina lutukang nge ka discipline na sul tukang suicide commit me yang hi kan hlau to lutukani mo ati tawang atlan chakang mase ahlom lo sei chu to chu mga maro chu helai chona chul baklaba. And another thing, don't give up on them. Don't give up on them. Don't give up on your child and your plans. Plans in wardro. Plans to him. Tip though he got at him. He took a pay. I like a tea. And don't chale phone. So one joining like a plans. I can't give up to Ranilo. Just like Archer. They may wander off. They may do whatever. And what we don't want them to do. But don't give up on them. And chale taiti. He can share. Don't give up. John love them, love them unconditionally, whatever they are, whatever bad news they bring you. Okay, whatever, love them unconditionally. That doesn't mean you should not scold them, you should not discipline them, but love them unconditionally. John, my parents don't understand me. This is one of the common statement that I get from adolescents. My parents don't understand me. Mo, intivem. In Sundayan, Shatiam Lojo Initiam. Shatiam Zonhan, the Zonhan part de Ugan Didon Manile. Masse a dignity norm, it can be true, and many times I don't think it's true. And one thing is communication gap here on Fawani. Communication gap here alian emani tulai to can issue pakadani gasha between the parents kazo fortune to idu min shatiam labitia it shatiam idu na like ishilem idu dante ishilem isoyem tam takhian soi chuang lo min zot leinem min zot leinem zo khera soi chau tura moti hi om to atun lai phei chu kanin chunga ni venge kan shelo room te kan nei atru sitting room hi ruak mai chini khala han communication gap he tam lu to ka kan du po ke ni pon no le pati pon kan lo soi lo fo no fati pon so khala communication gap bang hian engen adolescents many adolescents just assume that parents should understand them just as they are mo pakhat chulai chu oma an shithiam turani khalai kha communication kha acha tangai ni so understanding when they say understand me understanding based on their desire katimaya adu dan cho no pangina adu dan cho base khan nu le pa te khanin min shithiam tur hian an ngai to phone he a problem pakhat leni chumi chu ka do len chwa ka do ka thian te ne na chuta chuanin picnic ka do ka englo ve tur lom mase an issue chu kha khalo ni ta che adu kha anu le pa te nan ti hlotin lo chuan an lo phal lo chuan they don't understand me anti le hal to top me mi khami he mi idea hi kanin again I think it's kind of contagious mo kanin shi tamlu tu nge ni ya ka shelawa atame me ni kan patient chon thil pakhat le kan soi tu chu tuna kan ron so hi I'm not talking about the whole adolescents mizo adolescents okay I'm talking about those who have mental health issues okay this is based on those who have mental health issues not the whole of mizo youth chu sha thiam tor pakhat chu wang chuan mental health issues an nei pha thin ti na ni chu mo khang tiang kan englo chuanin chu wang chuanin enge kan nu le paten min she thiam tura kan du chuan ke mani pon kan nu le pate perspective we can she thiam ve ngai ni if we want our parents to understand us we have to understand the parents perspective it has to be two ways to lai to apoi mo lutok we don't fully understand them you are not going to understand them fully but still you have to they are your parents chu wang chuan atopa chuan an thu kan oi we have to obey them khalai kha apoi mo ka shi fo hi ni thina ni mo children don't often understand them better to obey them in the Lord kan ti turani tlat no pang mo hetianga ron kal po hi ka shi fo chu inu le pa te an ni chung hi chu an she thiam lo me the che amai ro chu nu le pa tlu kam hangai tu hi khovela midangan omlo chu wang chuanin an dik veke kan ti lo amai ro chu an thu oi hi mal som na don na ni fo chu wang chuan an thu oi phot me ro hi engeni ka ti dan chu ani fo me ni chu ti rualin nu le pa shethiam lo tak tak an om tho kha chu kan ko ve le thowa kha tianga han an pania ko wa hetia han soi ho kha acha em me ni kan ko fo ni mo heta fine ron san nu le pa kan ko an perspective ti khanan so tam tak chu mo kan ma te khanan in hawa anin chapanga ma said that was very good mo kha tiang kha apoi mo ta ni khalai kha understanding kha communication te kan du dan in share ti te khang kha poi mo a kan don up the thil dang common le deu chu ka chian de nu le pa pon an phal ka chian te nu le pa chon chu ti chuan an ti lo comparison mo between parents kan chian te mo kan engemaw te kan compare hei hi poi lu tok a tu lo I chian te khai ni lo ka shi fo chin chu I chian te khai ni lo inu le pa te hian an she chiang zok cha anu le pa te nan mi pon she chiang chu hang chuan in based on the parents assumption they know you they know your character they know how you are they know your vulnerability they know your character so they are going to make a decision based on those usually headline nu ta kha chuan maybe you have a different character maybe she was more responsible and you were not responsible in the past so they're going to do things based on your character and all those things so you just cannot compare your parents you cannot just want your parents to be like their parents kakatu it's a very big misconception mo chu wang chu khatila ya po kha kan shiat apoi mani ke mani lama hian lo ni fo thin ke mani ring tla ka kanom lo chan inu te hian an chhuatir me lawang che kha ke mani lam kha apoi mo te la kan ki mani lam kha kan in en lo chuan kan nu le pa te chu kan agani kan huat chuan an diglaba kan shia chuan kha khanin gap asiamanga kha khanin interpersonal relationship achianga kha that is going to cause lots of problem including mental illness depression whatever substance abuse more out khang tiang te mo khang tiang kha atam lut to kani so wang chuanin issue tam takhi chung kwa hian communication channel hian a solve thayani chuan coping skills kan share or life skills more. WHO has 10 core life skills. We know all of them. I'm not going to detail about all this: self-awareness, critical thinking, creative thinking, decision-making, problem-solving, communication, interpersonal relationship, coping with stress, coping with emotions. These are all the 10 core life skills. WHO core life skills. Okay, John Heng ahian enge mizowa ahian problem kan nei. Critical thinking he kan problem lian deuh nin ka shechina nia no panga adolescents a chuan. Problem analyzing ourselves. Critical thinking means what? Analyzing ourselves, our emotions, situations, okay, information, our values. We have to analyze them. Kan analyze PM. Kan katifo china kan again school system ahian by heart system kan kallu tukhiani kan critical thinking he at stimulate lo lu tuka. Chuwang chuanin ti hian a local kha kan ti mai an tam ni chuwang chuan kan in analyze thiam le analyze dan tur kan in zirti. Okay, we have to analyze ourselves. We have to analyze what happens to us. Okay, our friendship, our relationship, everything kha kan analyze thiam lo chuanin apoi china ni mo mi hi kan oi ma lu tukin ka sia mi zo englo hian kan oi ma lu tuk mi thu soi hi kan analyze lo kan oi ma lu tuk hi problem lian de substance abuse upon it HIV at upon it kan oi ma lu tuk analyze ang o hi kan in zirtir tam kha angaya ni one very sad HIV englo ni boka one very sad story hi kan englo chumo pakhat chu I know it's a bit confidential. Maset hil poi mo dunin kasya katsoi me nga an ming kan soi don chang lon ming po ka sha to bok hek lawa kan patient pakhat ka an a mai chia kha positive anya chuan anu apasal kha ani lawa anin mangai lutuk chuwang chuan apasal khan positive ni kha poilo ama ka nei don chuan atitani ama ka nei don chuan positive kha poi lawatia chuan he got infected anu loka khan a then le ta deisia ka san le ta deisia so what is he left with kha in chadawin in ngai zong in nein mangai takin omse okay if he says there's no problem fine mase what happens the khan a chwa san le ta de mi dang ava nei san le de ya so the husband is heartbroken okay lost his wife is infected khang tia angchi kha a thayani. This is real life. Chuwang chuanin kan engeni kan film khorangai thil hi analyze thiamang u mi soi zong hi big takin headline akhang ni ka soi don thau nain kan soi loga love is blind kan tia tiro adik thau mase it should not be blind kan in ngai zon chung hi chuan I'm not saying that ni chen ka soi khan look for someone perfect no in mulawang amma ero chu whatever fault the person may be having. Okay, I'm not discriminating. HIV loni po loni rose. Am I able to live with this? Will I be able to live with this kakhanime? Fault chu na yang character apo perfect to in hulawang. Ma se hi in compromise to ranya. No pui pasal nei hu hi chuan let it be blind. A little bit pailaw. That means hey kanin shithiam ton turani mo kanin englo ton turani amaro chu it should not be blind kanti na chu kan shithiamem whatever fault my partner may be having, whatever things that I don't like in him or her, will I be able to live with it even if he or she cannot change? Khatlai kha pui mo in ka sia no la ani lo chuanin anu a hianin kan boile chini cha por rui thei thil chungchang kan soya alo zuru ya lo ni pon eng anga rui chha in lo omta se will I be able to live with it nge ka chen mei don ka in sha thia mem ka soi tum chu khati lai kha bati kha ka ba engeni thalabe ka ti na lam thalo chu ni thonai ka soi tum na chu khami angkhan ablain torani lo ti hi ka ngai ve dana ni in ngai dana ni am chu ka sha chwang lawa ngai ve dana ni kha chuan chelna assertiveness peer pressure he chu ka soi tam lawang kan shave ka perseverance chelna hi kan mamo Hey, kan problem yan. Tuming kasi ani substance abuse upon sinakan kan so. Ingat ingat retail we all know the ill effects of substance. Even if we don't know in detail, we still know that it is not good. True. Kan shefek no pang tepon an siya. Til chalawani ti tal hi chukan siya. Kan taksa le kan riru le til enkima englo ma se a detailing in shelo mai la detail page kan thoka a thodan jong pusara khana so eng ka shelawa shepei lang chon a lo omzia hi kan siya ang hi kan shetok lo bok mo cancer cause thei thina ti chethei helai level vela hen kan shan level po hi ala physical dawa atak tak thoka a thodan le ni china kan soi ang khanin enge a memory om to dan hi chu shai lang chuanin kan hlau de wangem okate amai chu whatever that is I kan problem chu kan chhello shom kan tuar pe lo lu tu ki kan problem pakhat ning ka sha mo we want to get out of problem kan okay ka kan lo de ni man mo de le kan okay chu wang chuanin khatilai ha kan in zirti rangai ka zo chep to hei chu ka zo chep to chhel hi kan in zirti rangai chhel to sham ang uti kha kan in zirti kan in counseling a chuan apoi mo ani ti kha kan shia ta poi mo ni chuan pressure kha khatam broka pressure from school pressure from self hey pressure from self cha hi employment pressure the kansa pressure po hi ke mani le ke mani hi kan in pena salut tu dewin ka shia a he poi soi chu ka cha ka amai ro chu pressure ni mia lo hi excuse no pang ho hian kan mangfo pressure na salu tu kalom exam ti chha chuan ti te hei kan mangfo hei hianin negative effect anei lat chu lai chu kan soi du deu pakha chu ni a pressure hi kan mamo ti kan share the poimo make use of the pressure that you face chuan pressure brings out the hidden capacity in us hei kan share turni job pressure kan nei vek be prepared more for difficulties set realistic timeline widen horizon set your moral standards mo pathian chuan ring top meru in the face on job pressure hi true chu wang chuan tu na chang hian in prepare kha apoi mo em chu mental health issues khan tam tak a solve don ani job wanga problem nei hi kan tam lutuk social media hi chu soiwa katum lo chuan conclusion a chuan kan self esteem kan it ka soi man to lawa kan self esteem mi avoid thlaka a self esteem has to be based on pathian in min mangai helai min mangai lo ma se chungten min mangai lo ngai zong in min mangai lo ma se pathian in min mangai te hian kan base sangai ani lo chan in self esteem mi ti hian akalang nain han monga khita kalanga nai mulonga he ta kalanga min an du chonga khita kalanga min an fak chonga khita kalanga tian kha akal don ani so wang chan hi apoita ni John, and Kim in Harsan Apollo thinks it's for a purpose he can share the poem. There is a purpose in everything that we face. Katlaya kan kanin mo base na hinayang chuan mental health issues la ka khan min veng him donani base na eng polo thinks enge he pathiani ngat nge he thili kanu na ron thlen chuwang chuan engeni chel takin tuari la base la tila thil charon chuakang he har sanat tu tong mai la thil charon chuak thil cha chwa tir kan tu mangai bok chuwang chuanin khatilai kha don't give up mental health issues tu azia omang lawang katilawa thoi tak a prevent ang chauti kha kan sei do ani chu ni mero se ka hon kamang tam tama mani sorry so hi jong an tui thei talu tu ka.
So without wasting time, I'd like to speak from here. Thank you so much, Dr. Ruth Lal Manpui, for your precious talk on mental health issues of young people. Again, I would like to mention that ma'am is here in the capacity of a senior psychiatrist of Health Services, Government of Mizoram. She has had years of experience in mental health sphere. So I'm sure that the students who are here today, who have come here as master trainers, peer educators of the Red Ribbon Club, and members of the discussion forum, that we can disseminate information on mental health issues to our peers, to our family, and wherever we go. Thank you so much, ma'am. And as a small token, we would like to hand over this certificate of appreciation. Thank you so much, ma'am. I know that this is the afternoon session, post-lunch session, and you're all sleepy. We have to move on to the third session, so please stand up. All of you, please stand up. Ding look though. Yes, good morning. Can you please raise your arms? All of you, raise your arms, please. Nothing very difficult. Ding di hip rule. Please stand on your toes. Ding di hip ula, ban par ula. Stretch your arms. Kan labang don may lova session ngay nom deu alaom don. Oh, hanzivel teo. Okay, so we move to the third session. Our resource person is here already. I would like to hand over this session to the MZU Students' Council President, Ma Shiata, or Mem, to coordinate the session.
Is Miss Lalruasak arrived? Had Miss Lalruasak arrived yet or not? Please join me on the stage. Session. There are a little bit shifting and reschedule of our program. The last session, session 4, is shifted to session 3. Session 4, as we shift the session 3 and session 4, now we'll be starting session 4 first. As our assigned moderator, Dr. Irene Lalruat Kimi has a meeting to attend. She won't be able to chair this session, so on behalf of her, I want to apologize and take the chair instead of her. So speaking on behalf of you is Esther Puya, MZUSC President, Department of Mathematics and Computer Science. And since I come in prepared and being impromptu moderator, I want to ask your excuse in first if there is any inarticulation in my delivery. Without further ado, let me just hand over our time to Ms. Lalruasaki. As we've seen in the program sheet, she is a counselor of MSEX. I believe and guarantee you that you will find something new and worthy informative words from her. We all know that we are facing certain issues regarding HIV/AIDS, especially in this state in Mizoram. So let's all try to make the best out of it, and she may present her topic according to our convenience, English or Mizo language, no problem, I think. Let's just hand over our program.
Hita hyang ka timaya nga atsan chu kan Mizoram HIV in Mizoram ti ka topic kan iwang kanin Mizoram site ang tur khanin karon im buat saya Mizo lo kan omem omlo dro o Mizo tong kan sheve ka like dewin kan mang do nya in kulmuk mamain ka siya lecture type lawin civil hospital ICTC counseloring kan oma ni tinakan mi ton chin ang mi nge kan deal chin ti anga chang khanin kan experience karon share zok don chewa chu ti anga wazir tir ngut laming karon ti don law kan ang che nge HIV hi kan rama law hluara engang meeting e kan deal thin ti kha voin ya khan karon share don chewa claim in ngwai to in ka sha like there in man kan tumang kan no ta ya na chen ka da sei control kha angai bok don sia ma se poila I kiki kan ron tilang ve shim do Mizoram kan statusaki HIV mi engzat nge sang kha chukwa som kwa changin test kan nei chan to I tun September nikum September theng khan khiti zat khi I mi sing ni sangli zakwa som ni pakhat general ti khi raipur lo zung ani atang khian ki I positive zat ki mi sing ni sangsari zani somli pakhat te meu hi HIV positive mu chwa to kan nei ani ti chuan I khiki kasoi dwa lo nga hunte akal re lo zok nan lo en ula in sha anga percentage te chuan kiki ke mani civil hospital bi ka kha karon soi tum tak voinia karon kal chan deu khanin ka sha miron ti na chan kha civil hospital a hianin I January sang hi som hi atanga ni kum chung te kan data ni kimi karon lak chwa ki ni kum chung te khan khi tiang zat khi kan lo te sa mi sang kwa zaruk somriat pakhat changin positive zanga somnga pathum kan nei to a route of transmission khi lo en taula I heterosexual kan tia khianin inshat thiam dan tur chuan I sexy category shangin kan thena ni ke mani hemi I kan nako guidelines angin I chuta chuanin hemi I sex nu pakar casual ni lo regular partners ti te I ton sabop kan vatiang chi te khatiang kha chi shangin kan thena ma se khiki heterosexual a khan karon davika khiti zat khi sex awangin kai kan neya homosexual bisexual khi nakira topic shanin karon soive shim dona mi som thum in chiu na shiao thiang him lo man atangin mi som riat pakhat parent to child and fa te a som riat pakhat ti chuan annex atang khan karon soi zau do na tu tinge HIV ni tina kan te sakai ta ti la ya kha I voi khatal thi sentes ICTC ron kal toino mem ban pharin chem kalve shim kha ni me negative iron la kal ron kal to nom kha in ron kal chuan in sha anga hapoi turte mithai turte enge ni gan ti surgery ke zong hi tuna hian anron refer ani king ang mi pa nga ya adar na sa ti hi engwangi karon soi ngot na chan na la ya kha ron soi fia ka doa he kan soi ve zia apum lo tam takano mani HIV te chu enge drugs addict te enge sex mangkholo ho te nat na lom kan la ti lai khanin keinin ni tina attesting center thu te khan mi pa nga ya adar na sa ti hi kan tlang au pui ve thung siang a tinge kan ti chuanin ni tina tuna voin ni karon kaldon choma a ringot po hianin kan thut na huna chuan mi som nga vel kha doctor in an ron refer ani test kan la char result pe man lawin helai program kan e vain karon chukla a ni tin mi pathum mo ni tin mi pathum HIV positive mu chuak ang kan ni civil hospital a counselor panhi che kan thua chuan tu te honge ni tina kan test chu high risk group kan ti enge drugs vati thin te kha an ai khan ron kal thin chu innu le pa te point sha anga he mithai tu ringot doctor ti po hanan mani doctor pui po ni sen ron refer ve kani khatiang lo kala chang khan ni tina mi pathum sang hi som pasari chhovel kan data kan ena kan rate ni si kha chuanin mi pa nga ya adar to ti kha asoi lo thei ta lo ani mo chu nimin pia ani lo kar masa a po khanin ka client pakhat chanchin ka shilang cheunga kar masa a khanin nu pakhat hi ron kalani doctor in ron refera ama chu nu thau thade umei khania alo positive ta a oi lo lu tu kani a pasal thi san na kha 20 years back dai som hi malama khana pasal kha kai po ni seng tinge kayang khalaya kha ama kha ashok lut tu kani kanzot kha apasal boral nuwa khana lungleng kho har khan bial pa khalo nei ve nge ya masi chu po chu kum som kal ta do na ni chu kum som kal ta do na abial pa nei kha khan HIV alo kai reng ti kha alo in shemi alawa chu chu nimin pia karma sa i luka khan kan muchwa ka khang khani tina kan ton thina ni ti kha lo sheta ila ti chuan pani na positive muchwa upaber chu kum somriat pangami nya i han ngai ruat ula pitar putar kum somriat pangami chun upato tro kan muchwa ke ni po hian in kum somriat chunglam an refer hian o nang niang 30 chu o kan lo ti ve chang hi om chen aron kai bit beu chen mo an mani po kal thelo aron kai beu beu chen ani mi thai tu ra wangte a mai ro chu kan tum lo deu deu khani tin hiang kan muchwa ka ni chu wang chuan i HIV general dar to ni ti la ya kha kan soi lo thei lawa ta chuanin kimi putar kum somriat pangami kan han mu chua khi kan soi zau du chu dam lawin hospital aron oma example stroke nge ka she to lo tum lo deu khan HIV kha kan lo detect ta ni chuanin a history kan han la ta afa te po khan shock ani chon a pasali na bo sorry anu pui na aboral san nu alung len kho har lai khan khita changa kum kan han i enge nula pakhat khan alo om chil ve china chu chu i kumnga kum sari kal ta vela han chu ta chon HIV khalau kai fel der khalau ni khi kan record ani wangin i enge karon pholang ve do shim shima sex changa kai kan mu chwano pangber kum som pangami i sex kan lo mang ma to khop meya kum som pangami HIV positive sex awanga kai kan mu chwahan kum som pangani khan sex kha mang chon chau lamani lo kum som pathumani than lo mang dai to July chu voinia hianin kan ron share do chewa I nge kan Mizoram HIV in Mizoram ti ka topic ania nge Mizoram thil thenga kha karon share kha karon tumani meya I lockdown lai khan thil pakhat ka shilang cheunga het kal kwal hi kan ti de teng I lockdown lai khan kum som pangami le kharon kalani I HIV test tur khan I dana chuan HIV hi kum som pariat chin chau hian consent ta pe thei ani I enge HIV test hi consent te lo chuan na ko guidelines kan la zoma a thei lo ani ta chuan counseling ka lo pe engwanga test du nge ni ti ka lo zo khanin arukin kol gal lo ni reng ani chu kum som pangami kha ta chon anu le apan lo in then to apati api ti ne nan oma inga tinge khatianga a om ti kan zo kan zo khan I ingatan nge ipoi sa chu ingatan nge mana ka tia I achang chuanin thom no le nan te ho I enge makeup te ati khatia athil du asoya kha I mani meu han in zorna tan chuanin ho ka ti angreng ani chu keima thirna chang chuan amma ero chu thil hi anlo odlu to ka ta chuanin hei tuna delivery boy kan ti te delivery turang chi khami chuan lam khana lo chuak thin kha lo nia I chu kum som pangami lek ania HIV ron positive engwange sex wang engwange sex tu man thil kha adu lutuk o anga lutuk kha sumle pai thil ei tur le nan te ti me mo khatiang angkha anti dan system sang kha chu ka soi lawanga FBA changin account chanan siama khatiang kha kan rama han an tam to lutukani ti kha voina karon soi du ti chuan tlemin kan next sami tur te kha panhila yan lo bang ka man model ka soi pot dona I HIV hian mizo te min bumani ti khan thupui kha I Mizoram sin ani boka kan ron dale topa I a symptoms kan soite alang chuang ngal mai ngai lo khi min bum na pakhat ani vo in thlengin chu kan buai na ni I tuna hospital a khan ron kal ula I HIV ka in ring lo si khanga tinge ni tin kan mu chwa ni khata achang pe chana anne lama te kalve ni chu ke mani tan pon ni khata hian mi achang chuan kan ti fu lo kan ti mea mi som chuang ni khata detect chang kan ne ya counselor panhi chau tan chonu tu nang huna result tu na po pe me kanga ka chan pa yen engza tak positive ang kha kan han ma chon ta khan ya dar kar ni khatle ka khan I arap thak to lu tu ka chu enga tinge kan ti chuan I tu na nat nan ron nei ta ni
zia chu tuna kan mu chwa tam ber hi natnan ron neya nimin pialo ka nu pakhat I kakoma alo positive in ring hlel na inei chinem katia akai na hun omang chu I kumsom kalta vel de ni chuanin a symptoms kan soi ho ang kha kas zota om vel tun main ka pi nei tu em katia kumthum kalta om vel alo nei to adam vele me ani I cher vak to em o cher vak ka thau le to tiang khan a symptoms kan soi ti kha mi shinga a cham reng ro kan lifestyle ti changkang to kan ele in te kha wang khan mi in HIV kai reng khan kai lo mo in tia mi danga I alova inge pudar china ni zia chu kumnga kalta inge mokalo I sex kalaw mga example o I kumnga kalta sex kalaw mga I kasisel na ka achat chuan kai lo nga ka ingai vo ina chuan ko shena ka in mga nula fel takha kalaw ni tani he ta tu na ka bial pathar chuan min ring hlel mi alawang kha kanin kaidar na bul ani awangin vo ina han I university students de bula han kha karon soi do shima a symptoms kan soi ho te hi alan chwang hal mai lo awang hianin I HIV hi kanin kaidara a symptoms si tu na kan soi ngam dana chuan I kumnga changa kumsom thleng hinnat na nei lawina om thei kan ti are nya o kumsom te chu rei de umenya chang khat lian kan ti kumnga changa kumsom thleng hi HIV symptoms nei mi alo HIV virus nei reng si han treatment lam mi alawin a om thei to ani ti chuan pani na I natma nei lo te chu kai lo tura kan ngai o kar masa ka case thar ka ron present ruk ziu zewang cheunga I kimi alan na chu karma sa khanin tlangwal pakhat kumsom ni pakhat mi kharon kalani tlangwal po ni lo so na lo thak via mo son thak na nu khalo positive sia chuanin anin break le dai to le ngala chu a positive kha hlaw lu to ka aron kala alo positive tange ni chumi ka kom na chuanin I khoi tangai kai nge nyang ti kan zo khanin I a partner kan tia hemi enge an partner testing index testing tin kan tong kama kan mga chumi chu zong chhuak tura ti kan ni to ni mo confidential po kha engi mo china ke mani counselor te chu an partner te zong chhuak tura ti kan ni wang khanin I vasoi theina ang permission khamin pedeu to ni chu kan zo chang kha kabial nu masa te ho chu ka shia chian vek kasia chian vek atang hang kan kai china ni ti la ya kha voina kan ron soi du a chuan I ki pathum na HIV min bum na kha chu tun a khan ka soi kai ka sia a kan mi sia chian te HIV kai lo tura ngai na lian tak kan ne he hian min bum na selu to kan ye tu tinge I kop thin chen kha chumo ni khata hian in nui za thak lu to counseling na hian sex an manza thi kan lo zo thina I an soi lo ngam big lawa counseling room a chuan an soi nga lo ngam lo ti meang I avoi lam kan zon ngai lo mo mi engzat nge ti hi kan lo zo thina ni mi som chuang sex man pui to kondom mang em ngai lo I kai ring em pre test counseling a kan lo tia ring lo an tanga tinge ka shia chian vekalo man ti chen Mizo hi mo tuna hang ke pui ron in soi la min shet rewang mo kinang ni ho po kha han soi ning la chumi chu ka pa nya ka thian nu ti chen kan in she lo tham kan nom tak lo in bel chan chuan chu wang chuan ma si kan ling kai dar chur si la hi amang an thak la ni chu karon voina karon nge soi tumber a prevention na kha ani a I in she chiang lo tham kan nom lo entir nan ke ma hi tu mobile nu khalo ni taila HIV kai na tur ko nga lo om don tela ani chu thu soi china counselor nya kai lawang min ti rok theilo o I HIV kha kalo ni ro reng the I bulami zong kai anga ngai ro ti la ya kha khami buwa kan let le kha ngai chu la ya chu veina han karon soi tel le do chuan an next hi tun la ya I thalai ti a hian HIV hian hemi kan next topic next session hianin hei marwa ti PWNM lampang ten an testimony te an ron soi do na I an mani lam soi kha chu thushan lo da ta I la kha chu living with HIV ang khan ron soi dong ke chuanin tun lai thalai te hian HIV hian engangin nge hung ani a reality ron shel chau ka tuma ko shana hei ka soi china min som ziu zewa I abikin thalaya in rin lau dewa ang hong dan hi karon share do cheu ni pakhat na chuan eizon na konga engtinge eizon na konga Supreme Court mewin enshan lau tura ti la hian engatinge eizon na konga ang hong dai tia kha karon shel do cheu chu tuna hianin foreigner na tho tumin la ve me theya vo in nge ya po katong ani I foreigner ka kaldo na ti I Macau te Singapore te mo ezon na ko nga culture how hi tu na han HIV test nge ngai to ni anron kal chi na chung ron kal te atang chuan positive kan mutam lutuk alung chha thla ka ni lo nan lo la fel to mit tui nen I hey hostel ang hian anom ta I attend khat pe chu an mi stay tum ni ka ko to ni kar ma sa ani lo thama sa lok po khanin I pakhat kha aron kal ya engkim lo nan rul ngai bok khatyang an eizon na ko nga ang hong hi kan rin pia ba khanin phak ba khan HIV a virus ina an tho chu nakin an ron soidon a treatment chat zia te po kan la soidon tu na chuanin dam nun ti toy tu ti kha kan pai to o HIV counseling room a chon an ron positive a lau lau zia kan lau shilfia a mer chunga ti vo in ni a hian heti zonga ka soi ka ti chuan khami ka ron soi do na chan chu in rin lau lam de wa ngong ane ya kha I vo ni lau kal ti han lau sha ula ka do a I ezon na a hianin mania po I an poezia chu kan soi nga chu Singapore kal tur pakhat chu aron kalani I housemate angin akal don ta alo positive si lo nan lo la to si alon rule na tur kha khoyami nge nyang ani I enge har save te tang hanin lo tum kha nia an nuwa I chumi case chu kum thum kal ta vel kha ni ka boy puya chuan an nuwa kan mule chu engtinge om ta kul ga langin alo omani a mela lo porvek achan chu alon kha arulangai ti su ti ngot theini lo mo chu wang chuan ezon na ko nga ang hong chuan sports lama hian tu na hian voini po karon kalma in profile khel turan om lenge ka shilon ron kal le tan to a profile kan ti te boxing kan ti te phaya enge ni hey football khel tur te mo inga mo an demand thina ni chu HIV test a hi heng low positive ta si I an result va show ngam lo hi kan tong tam lu to kan negative result min ron di la hi chu wang chon kan rin pia bak hian HIV hian kan rama hian ngong ala nei don an nat na chau hi ani lo ti la ya kha voine hanin ri ro lo shetawla chuan zirna konga a hong zirna kong te hi makdeu main university thlengin in kala angai lo mai the keni po university kan kal thengin enga ma kan show lo HIV a mai ro chu tu na hianin he MBBS zir tour foreigner zir te an tum ta a I he money bank exam ang chi te anron demand na sa ton chon nurse training tour kan ti te anron demand na sa ton ni kha an va show khan an lo reject don ti la mani lo ma se an status akha tu na lo nang ma khalo ni ta angla ingam zir na sang zo ka kal don ta la heta I result kha submit wangai ta se HIV ni ti kha I soingam don lo lu to counseling room a hian e an nu le pa te shat po an ngam lo chen o chu wangin zir na ko nga hia po hian min la ngong don chawani ti kha kan ron soi le duwa nu pui pasal nei ko nga ti la ya khi in mangai tak in nei du si a virus na china khan piru ti khana soya kha I anin mangaya I counseling room a chon ti hang kan lau shi in mangai takte in thena thamani lau ti hang kan lau shil china ni amma ero chu in nei na hi chungkwa a involve a ro ge mani thu ni to lawa I tum kha chu tlangwal pakhat abial ni na mangai lutu a positive ti po sha nei edu amero chu ami panu le pa te khan a mei chenu le pa te ne na khan HIV an fa pa kha ani ti an shil lau chuan palayan tir du big lawani mo I ta chonin a me cha khana nu le paril ro sha a bial pa kha positive ti anu te nan sha cho am phal don si lawa counseling ni enge tumenge mo zat miron kom thina ni chung ang case chu kan nga lu to ka mo in nei I nupui pasal nei kong thleng hian ngong ala nei do na ni ti kha lo shile taila ki ato ber taksari ru tharau a ngong thei ti ki ka case pakhat ngai nom deu kan share ang cheu nga I tlangwal pakhat hi นี่ขัดจู Saturday ยันนี่กัน half holiday เวียอารมณ์กะลา test ตัวขันอารมณ์กะลาเนี่ย test ข้ากันเรา close ตัวเทตัวเราว่ากันเราเตีย counseling แต่มินไปเทียมข้ารอนตีนี่จุดที่จุดลงกะโรกันเตียนี่a positive ก็ปุยนูแล้วเนี่ยกลุ่มกัลตาหันจวนa positive ที่อาเชตตะโจเสียจุดกันสวยเปียงเลยลูกตูนักกันดีลกลางปุยคีมานี่ดูทันนารอนกัลเฮาคีมานักเบียลปากคะแนนเซ็กซ์กันพังa positive ที่ตูนักเสียกับเบียลนู่นเนี่ยตีฮีกันตำลุตุกมิโซะโมจุบางินข้ามีอป่วยมาคันคลากันสวยเปียงตัวอันนี้พอจุดอย่างเคสจูนี่ตาเนี่ยจวนนี้กันหันเดินเร็มก็ไปอินโอลุ่มตุ้มคันโมจานะvoiทุ่มเวลคารำหน่วยเรากัลตัวช่วยเนียนจวนนี้จูมีรอนดอร์มาจานลูกจวนนี้ก็อินไงตัวเฟียเบียกินักก็ละก็จงใจตาอาตีนักตุกาเจสินก็กะลังก็ positive จังก็อินออกหลุมหาหลังมีรอนว้าวตินี่จูโมกันตาหน้าพันเด่นโตลุตมาสิตาจะเองเด็กก็เตียงโอ้ติข้าไงตัวก็รีรู้ทางก็จงใจเวียนี่อันนี้ขันินเราไต่มาเราเปลโตข้าอย่างงี้อารมณ์ตาข้าก็จะที่ขัน counseling จุกเปตา HIV หลมเลยเนี่ยเรานี่ปนตีข้าชิลไม่ละเบงรงอาลุดเราโม่เจียงเบงรงอาลุดเราก็อินออกหลุมงาที่ข้าอันนี้ไม่มินชิลจูโอเคอันนี้จวนที่ขันก็ติดตานี่วันนี้เดทข้างไงนี่ข้ามีข้าโม่เองที่นั่นอารมณ์กันเลยงี้เนี่ยตัวเราก็เดทเราจวนก็บ่าวโดนวันนี้บลัดกันหลังกันเจสังมาเซกันโคลคอยหุ่นตัวแล้วว่าโทษจะน่าชวกโดนใน result จุมีจุอีดำเข็นมินเตรียมรอก็ที่เวทแล้วตอนนี้ตาจอนโอเล่อติยาคันpre-test counseling ที่กันยินเปียโหตาเนี่ยจอนโทษจะน่าเราเนี่ยเกี่ยมาตักเป็น result ข้าก็เชื่อจ้ากันเนี่ยโทษเลยเราเนี่ยโทษจะน่าเราเนี่ย result ข้าช้าก็ลมปุยตัวชิลลานี่ก็หักเลยแล้วเนี่ยไม่รู้จุมาข้าอารมณ์กัลตะเรียงเรา Tuesday ก็หักเลยเรากัลเรากำมังอังตัวนี้ก็โทรพูดปานเนี่ยนะกับว่าสวยเองที่เงี้ยยังโอ้โกลไม่จีนยังให้มีว่าโกลงดที่กันติงไอเรานี่ counseling counselor เต็นลุตุกันนะฉันจูมีว่าโบซุยว่าขี้อันริลรูอินไปมาค่ะเราอินติดลุมมันมันนี่โอ้ข้ากตีนี่มาเสียTuesday ก็หักเลยจู Thursday Wednesday เราเนี่ยอารมณ์ลำตา break ลายยันอารมณ์ก็ละมันเชื่อไหมจูอาจวงชัวงาละรูมเล่ลำซงเตคอริดอร์พยาขณะเอาเพย์เจลจูเมียโมจูวันนี้ก็รอนสวยดูนะฉันจูกันตักษากันรีรู้เจ้าเราเฮโมทาราเท่งกับมินติดเฉยตู้อะไรนิดตะฟันตีลายค่ะเราเชตาอีลาติจวนข้ามานี่อันปุยกบจุงจางเฮวันนี้กันรอนแอดเวลดัวก็สวยรังบอร์ลุตัวก็สวยจีนพวกอีพอนมานี่อันปุยกบ MSM กันตีเฮกุมกัลตาชุงขันิน Civil Hospital มานี่อันปุยกบ positive percent to 8.15% นี่คิอัสซังนี่โมงั้นติงเงี้ยคิดที่อัสซันนั่นฉันกันตีจวนอันนั้นเซ็กซ์กันตีอันนั้นเซ็กซ์จังหัน HIV งั้นติงเงี้ยกายอลเลียมอลอลมันนี่โมจุบันจันขี้กันมูชัวขี้อัสซังลุตุกะขี้ลายขี้กระรอนติลังดัวตาจวนยินมานี่อันปุยกบเตฮี MSM ตีขันกันรอนสยา underground ตั้มตะกันนมตีลายค่ะเราเชตาวุลาขี้งาตูนักกันหมู่โฮฮิจูเฮคนลายปรนกัลติยาอันบ้านไว้จังกันว่า classified เทเฮายันนี่เรากรอนสวยตุมาจูโอ้underground กันตีจูมีปังไงโอ้นังมานียังเกมานียังมีปังไงยังไงอินไงมาเสมานีอันปุยกบกลัดทีโมอินรินไอตมันอมังโมกันรินไอตมันอมเกนี่ปอจวน bisexual คิติเทจงกำcounseling room จงกำเดียวกันมั้งโดเทติเทที่ห้างกันเราใส่จีเนี่ยโดเทบอกติเทบอกขลายค่ะอินงุยมากรอนที่ฮาร์ลุยเจ้าเนี่ยค่ะโดเทบอกติเทบอกที่กันตั้มตัวลุตุกอันตั้มตัวลุตุกให้ HIV กันให้กันสุดจัดง่ายบอกกันเนี่ยก็ตีนะฉันจูจุ่มขัดจู counseling room มาเฮียนกันหนุ่ยจะลุตุกเกี่ยมาปอ le khathiam tu hey mizo anga chuan an le khat zir na po atop kan tiang chi anga zir kha private hospital chen ron referral yel chu chuan alo positive ka confirm ta counseling ka peta akai na risk behavior kha kan zot chuak ta ni po na bial ni na nga ran me ya ma se akai na kha chu anal sex dai an tamlu tu kan ye I fiam thoin mei cha te pui kan film khurangai kan bial pa the han bial pan lo nei ro reng the oh chu wangin khalai te kha HIV a hianin bisexual an tam to lu tu I alanga tilolo ho hi chu an lang sara ni si lo kha vo ini han khatyang har sat na nei in chuan university student tur min ron kola I whatsapp min ron bian tam lu tu oh ka she tu voina hang ka ron kal she lu tu an chan chu aruk te mi ron contact thin hi nom thina khatyang ho khanin eng mo ka soi palan hlawanga ka tia voina po amai ro chu kha I kan ram din hun dik takani to ni ti la ya kha kan ron soi tel do a ti chuanin engwangin nge an pui kop chu kan tam peer pressure mi zo chu maklu tu ka inti mu te hi vuak sim te hin omani an nu le pa ten an rong kal non le a kanu le pa te min an lo sha min vo she pa ka ti to ngai lo a sim thei vuak sim thei kha chu I enge I are thei amai ro chu re thei lo khami apia lam ho kha chu counseling room a kan chelu tu o khatiang ka chu chan pui na kan pe thin engting e him taka I nunan manang ti kha tlangwal pakhat chan chin story kha headline ka da du lo chan chu enge molli ka pal ka lawin ka share ang chaunga what case hi ni adam do inu what ta hanaron oma I a u kha ama ron kal thelo wen counseling kalau pe ni alo positive ta se a u shil hailu to kha a u nutling khan kanau hi a positive lawang positive na tur pakhat ma nei lawati ni I tlangwal fel ko shan thila lo zana chwa ngai lo I bial nu nei ngai po ka shelo ti tlat me ni chu katia chuan nakina adam tle ma kan de una ama chu ka ko mang ron shwai thlang che katia an ron shwai thata ni kan ko ma atto pa risk behavior kan mo chwa tak chu a an pui mo bial pa lo nei ro reng ani chu heng hi an tamlu to kan ye chu wang chuan he kan ram din mun ani a kan nun kan film khur hle kha ngai ti le photila chuan ka conclude to don I atop na atan chuan high risk group kan ti na china high risk ti khakaron soi ziu ziwa hemi na ko ina high risk ti akan mention bi ka khichuki truckers migrants IDU injecting more FSW female sex worker ho ai ma hian mi pa ngai HIV kan hutam to zok ma ngati khi karon ti ngam na chan a chan chu mo hemi tuna high risk group kan ti khichu NGO kan ti ho hian an vil ne lutuk kondom man na chang ti an share lutuk zo ka ni chu pa ngai in ngai ka bial pa ne kanom du na I kondom man kha chu engi munyang ngai ho ang level a hana darlak lo to hi kan chut cha lo chuan kan ram hi ala ro pui don lo lutuk I tiang ringu ta kanom chuan tia kha I kan ron soi du a chuan in ngai zong te zinga HIV in kai chong an tam hi HIV aning kai chong I ti hian kan tia in ngai zong hi tun lai in ni ve ke ka ti na lamani lo o tlei rol ho bi ka han 6 man hi maklutuk turan ngai ka ti me hey thil thleng nge man lai anga chuanin in ngai zonga ko ngai in pel ringot panan laya I khatyang generation kha kan lo pel thui to lu to in ngai zone hian sexy akeng tel to a hian an ngai amoni le ka ti voina po karon kalmai in pre-test counseling enge mo zat karon pe man kan zot me ni mo kan zot ta sex mang mia lo ton pakhat ma ka nei om ka shelo voini karon kal ringo ta po mo ka virgin ti thap tur kha anom lo re ngatinge kan ti cha ani ngai zong de ka sex khanem he na mon manga an ngaya an nu kum ni thumvel kum pot ling lo that thumvel ani ngai zong anin chena an nu de wan chan chin an hanin chu kha alo ler sia alo chu ti sia ka lau ti aron kal hi an tamlu to ka ni chu ven in ngai zone hi hi sex hi I an lo mang na salu to ka chu wang chuan HIV hi kanin kaidar na sa ani chuan Mizoram a hian hey condom promotion kan tia condom te hi I kenza lo tur mo I man kher tur ka ti na ni lo atul hu na manata na kan ne angaya sex education hi Mizoram a kan in zirti rangai hle thil pakhat ka thei ngil in she chiang chung chang a han khoi lang ye ka she to lo ka ti chuak lo nga in she chiang te atangin kanin kai darani ti la ya kha pakhat kan soile du chu hey I shia chian te a chon condom te ngai lo turan ngai nge ni in vi tom lo te kha emi injecting a pon tho tum khat ka case pakhat chu u now drugs edi kan ita ron kalta I man tom ngai em mi dang ka tu ma ka tom lawati ka u now pa che ka tom ron ti a u now pa che tom kha aron positive ta ni ho chu wangin ani khalai te kha I kan shia chian te chang hian HIV kan in pass he ni ti la ya kha kan ron soi kha ka soi tura ka ti ka soi mai ani a kan ron soi le du a ti khan condom promotion kan ti te sex education hi Mizoram in na sa zokin kan mamo he chu zir lai mi thiamin ne na kina po discussion sang in la telanga I tun kumsom pani an ni atang hian mo kumsom teenage an ron thlen don atang hian sex education te kan lo zir ti rangai to man lai anga in ti ngot chi ni to lo mo kan naw te chu kumsom pathum an ni vela changa sex lo mang na sa to lu to khi kan tong tam lu to kani ti la ya kha kan ron soi tel ani kalome
Thank you, Ms. Larwasaki, for your enlightening speech and presentation. I think we have a little time. I hope we do find something valuable in this session. So moving on, let's have a brief time for a Q&A session. If from the audience, I want to request our audience, the students, not to hesitate to ask any question. So is there any queries you want to express or exclaim through question? Let's feel free to ask. Anyone?
Oh, ma'am, let me say in Mizo. Coming to Ram Sang about to Ania, or Michelle Tonga. Because all the sex education, Mizoram in Kamamo, the conclusion of Haniron Soitela. To me, at 20 Mizoram HIV AIDS din Hunle, Shangshangiron Soiboka. To me, at 20 in Atang Hianin in Zirtir Shang. No Pangatang in Zirtir Neila. Tido nila masya kumno pang taktak HIV AIDS le tiang nama bonus to taktak an tamtani enga chang hian nge in zirtir na pe ila eng age group hi nge zirtir na dong nem deuh se ani la pot enga chang hian nge sex education hi nei ila kan ram hi na sot puya irin chumi chu
ding chungin kan changa chumi kuma changin a chati lampanga kha nge research teva beya wa englau kan di lo amai ro chu kan environment na chang hana shat ve ni no pang harwang ma no ma chu na chi na ka case pakhat ka present cheu kumsom panga mi kha kumsom panga ni ti ka shemya lo mo anula ul me ni khatyang ang deu khaning tha kha chu no pan nge thil angai na an shia ta chang hian an mani level tok hian tu na chuanin zirtir hi apoi mo to kan next generation tu te hi ka tu na changa kan train ngai ti hi kan thupui ni to a khata kha chuan chumi kumsom ti te kumsom panga a khan chen chu naw an lo pai ti ti to ni chu wa chuan a kumbi thla kha chu ka soi theilawa a mai ro chu ke mani naw te an mi zia te kan environment a zir hianin zirtir mai ro lukaum to lo ti ang khan kan chang ang che
Okay, I think there is no more question. Once again, I want to express our unfeigned gratitude to our resource person, Mr. Wasaki, for delivering such informative words in a nutshell. Once again, we thank her. And let me just hand over this certificate of appreciation to show our gratitude. And now we will coming to an end of this session. Moving on to the next session, let me just call our moderator, Mr. Arler Schwolirena, Link Faculty Red Ribbon Club of MZU, to conduct.
Hello. So good afternoon, everyone. I believe that we must have been seated in our seat for quite some time now. And in order to refresh ourselves, first of all, let us all stand up and stretch ourselves in order to refresh ourselves. Because you've been seated for around more than 2 hours already. You can stretch yourself, raise up your hands as much as you like. Yeah. Then we can all be seated by now. Okay. So this session is about HIV self-testing and living with HIV/AIDS. And we have 2 resource persons. The first person is Dr. Henry Zaudin Lianapatsuo. Sir Henry is a faculty, is a fraternity of MZU. He's a faculty of Department of Social Works, and he is also a project, I believe he's a project director of National AIDS Research Institute, and we are inviting him to speak on HIV self-testing. So first of all, let us welcome Sir Henry to the podium. Let us give him a big round of applause. Okay, he's an investigator, sorry. Then the second resource person is Ms. Vanla Ruati. I have a list of her biography. Then I'll read it out. Okay, Ms. Vanla Ruati, she's a president of Positive Women Network of Mizoram, and her story has been featured on the extraordinary column of the Reader's Digest, and she has been an awardee of Women Exemplar Award by Confederation of Industry, Delhi, Union Minister. Then her story has also been tweeted by the government of India. So we will be welcoming Ms. Vala Ruati to the podium. And before we start our session, we have a slide, small video clips to demonstrate how this self-HIV testing works.
HIV hiện cái là đi một cái nghĩ là lấy cái cùng thể hiện là vật tu bộ hiện cái cái thì phải cái tu mà thiệt là vàng hiện cái định một chuyện chuyện nhà bồi một em để bồi.
HIV chung cha idin mun hre chiang bu ni chuan HIV self test mangin rang takin hre thaya HIV result alo positive amo negative ni point ICTC confirm le nge tu ani
HIV positive kan lo ni pon kanin en kol thata ART dam doi kan ei chuan viral lot ati niama chu chuan in midang kan kai chhon theina tur ati niam
mani HIV in test na hi mani din hun en fiana ni a kepo ka in test to a ICTC ka test man to bo he test kit hi khoi mona po man theya nang po lo in test ring eng che.
So to talk more on the HIV self-testing kit, let us invite Dr. Henry.
Hello, everyone. I thank the Red Ribbon Club of Mizoram University for inviting us, MSACS, and of course the authorities of the Mizoram University out here. And this initiative, actually the self-test initiative, is a part of course, a research under me, which which have been taking place since last year. Okay, it's a one-year research project, so we are collaborating with ICMR NARI. I think all of you have heard about what ICMR is, no? From the COVID-19. ICMR is one of the premium institute in India that caters into anything related to health and also pandemics. And also, when we talk about health services in terms of how, people are rehabilitated through, pharmacological treatment, etc. So they also undergo various kind of research, and it's quite fortunate that the university is acquainted with them through this particular research. So this is a research activity actually, and so we kind of got invited by the people from the Red Ribbon Club in Mizoram University, and so here we are to talk a little bit about what HIV self-test is, and so it'll be a little bit shift from what we have talked about earlier in the sessions. So this HIV self-test is something very new, even across the world. It's approved only by few governments, like the United States of America and a few countries like France in the European continent. And so far in other countries, this particular breakthrough has not yet been used. However, in India, we are trying to make sure that this particular breakthrough can be utilized by the population, because it gives so much accessibility to people who do not have the courage, or as a result of stigma and discrimination, people don't have that kind of courage to go to the ICTC centers for tests. And so this particular kit would help them test themselves at the comfort of their home or any other place that they're comfortable in. So that's the whole idea. And apart from this particular objective, the whole idea is about making sure that the objectives of 95, 95, 95 is actually met. Okay, so meaning that any person who are infected, at least 95% of the people should know their status, and out of the people who know their status, at least 95% of the people should get their art treatment. So kaka atumber tsuni MZU kan triat ma chuanin in enkol that nakha in enkol nakha kan don theivat khanin kan tan chuanin mihring pa ngai tak mo kan nun theina tura ka kha apoi mo ni. So we have been doing this research activity across colleges in Aizawl, all right? So this is a research activity that takes place only within the Aizawl Municipal, Council area, because, methodologically we believe that the AMC constitutes the highest population as far as, any city center is concerned. So we thought that it would be representative, or whatever findings that we have here would be representative of the whole population among youth in Mizoram. So our target groups are people like you, aged between 18 to 24. So those people who are 25, of course, are not included as part of the experimental groups. Oh, kaka include an it talota. So HIV self-test kaka annay thelo tina ni so kumsom ni pangapum lum to tan ka chona thelo amaron so kumsom pariat le somni pali inkar hantimete ang somni pali le thasom pakat po kanala theito. Oh, so kaka kita kianin stall om ta na kina kanan soizo huna kanin enge ati thenghala ni ti kaka kanan soi tel dua. He research activity he near till enge it's not just a random research activity anilawa, it's a kind of an award actually presented to us because we asked for the proposal. So young research category award tel anitane. All right. So India, so in Tirani, so across India, so we are the people to actually get the award through funds that we get from the ICMR, IAVI, TNETA. So USAID's funded through a hemi activity. All right. So hey, colleges trang Patsunga University te trang bana te ngeni nursing colleges kanan tiang chi ate ten ikfai law college kanan ti ate po activity hi kan nei chhozela. So we have been doing these kind of activities across, and so we will be continuing to do it across the communities in Aizol hey helai municipality area po kan lati chhozel donani ti kha kan soi le duwa I so itong kanin HIV self-test hi na sina kanin muwa niatle min atoy de uleka clip ka. There are 2 tests mo all some tolu to ka. One is a blood-based one, which like if you know hey diabetic mo hey test kami kit ang daw kanita, but kai kanin alana lawzok mo akita hi thalo to ka. The kit is so well advanced that it doesn't provide any kind of discomfort to anyone who uses it, okay, even the blood-based one. So people, of course, including me, I'm also afraid of getting pricked, okay? Till today, I don't like syringes or any kind of sharp, like articles. So people who are afraid of that, for people who are afraid of, being pricked, there's another one called the saliva-based test kit. Oh, so heta enge hania hemi kan gamza kanin han swap da ulaka khate nga solution ne na noi khani meta da kira khita ken stall no ma kan naute no ma chona ti du tan kha chonin an lo shil rek me non chone, okay, khilai enge ni corridor a khan om ta. So engkem an triat tur tele khate khanin some exercise enge questionnaire exercise ti tur po kha om bok ta. So hete kan nei lai khanin hey heta I think the students council also have actually told students across the department. So there are a couple of people who are going to the stalls right now as we speak, doing their test. So sang khadvel hi kan test only. We have tested more than 1,000 through these kits. So and we are going to test another 1,000 or so more among the youth, like I told you, 18 to 24 kaka kan lati dona. And hey hemi kan triat thar timela thil pakhat kanan triat suwa. So colleges then so of course we believe that people who actually get to access colleges are more aware, are more aware about HIV tests, and so happy to say that reactive case and laom manglo topani to na hianen. All right, so which means that hey till heta pol sang MZUSC our partners MZUSC, especially Red Ribbon clubs for that matter, and NGOs where like Mrs. Marwati and all are working, have actually worked a lot in certain age groups that we are catering into right now. 11 to 24 akan a work chou zelti na kaka aron lang chuak ve chou don in alang ani ti kakaran so idwa so itay chat lawa amaro so kan lati chou zel awangin. But hopefully we again I have high hopes that the message that these awareness programs, training programs, or any other advertisement details that are given by the concerned departments work again has actually worked among people your age group kaka alom in country, and we hope to find the same results in Mizoram University also mo kaka han kan base ini suan hemi self-test here, like any other test, it's a screening test. Mo screening test and yeah. So which is why screening test, hey, 299 COVID ka, let's exemplify COVID for example, like kami rat test aka screening test so anitani. So in negative mo positive upon you have to go through the RT-PCR mo han check like kating ta nga pregnancy test po self-test po kanan tita tetsonin amazo doctor ate kanang kalle to make sure that whether the results are actually accurate or not. Mo katingang ka ani chauzela ni mania in test akatsu since hey professional ka kanni lawang kanin it has to be we have to go to professionals again to actually seek for help. Tro so katingang si kanin HIV self test po kakanya ito kinahianin hantam de ulek pula so alomom don to ka amaro so hey niya tunlay class han suspend ngot kaso tilti thei kanilawa. We hope that this message is carried through, to your classmates more across the university. So install te kan hongdo na kan department a yanin kami self test ka ane thai reng ani ti kha enge in thil kwal don ani oh in thilanga te chuanin antiklai ponin hemi enge hemi office hours ka chuanin I nei thei reng Department of Social Work khanin okay nari at thokha ka nilawa I mean hello than chuanin I work here Department of Social Work associate professor angin ka thok me ka ni oh nari khachu keima research partners hoten ni all right ICMR nari ka research partners ten ya te chuan nia an mani IO le MZU IO te niang chu khatenga hetenga ti chho hi kan ni ti kha kan thria tanga ya chuan I nachina thil ka soidu pani anron soi I enge anron soi ngam chialo achara chu research thil ani lo kan thriat chialo wanga kan soi ngam lo ti kha tlemin kan ron soi du lo ka 2 points pakat point chu me che hi substance abuse I hianin an lana zok ti kha research findings khana dik ti kha hria tangai o hormonal engeni thil adan lama wangle DNA structure danga wang hianin rui thei thil meiche hianin anti hianin angong na sa zok ti kha mu chu ani to ti hi kha kan hria tangai all right angong na sa zok not because meiche in ni wang dilon because you have a different DNA structure more hormonal structure adana wangin chu wang chon khata khanin engeni tlema han aware do kha angain ka ria ka mu chu to ne he tuna po research kan ne female substance abusers po research kan ne to wang khanin chu khatiang kha om ta ne tin pakhat le chu he sex and sexuality in Mizoram among youth college students nang mani ang role kadan ti te po hi kan ne to kima engeni heavy PhD ka guide azara awarded ani to boka sex and sexuality chuan in major research chun ta po alanianga heta hianin nachina kan han soi I entinge kan tiang you know these kind of sexuality kan ti hi Mizoram hianin I kan thriat thiam dan hi ala chiang chialo wa chu wang chonin sexual education hi kan mamo zia ti hi aron lang bokani oh sexual education kan tia khanin it doesn't only related to intercourse lampang ringot anilo ti kha kan thria tangai oh male and female intercourse ringot anilowa how we are as a human being ti ringot po hi enge kanin kai shoi thiam hi angai lu to kat mi tam tak enge tuna pansexual kanan ti te asexual kanan ti te poi kan omnok to ni thalaya hianin mo kan om to tak mizo thalaya hianin hey hi achana hi enge tinge ni oh is it enge based on you know choice kanan ti te po hian ni ve thengem or is it because of hey tunlaya pe chonin you know Netflix kanan ti te Amazon Prime kanan ti te Hotstar kanan ti te kan access ne samto se anmani hey production trim hi sexuality le gender hianin hey unliberal lu to kan ni tro right hey thil tun ma kan mu lo tam tak te po khat khan ke mani thalai ho tam tak po kha enge kan ni ti kha aron question thina khanin thil nu le pa te ni na kan han zirti that lo phei chuanin you know that whole shit thiam lo na that misunderstanding kha om ti te mu chua kha ani ti kha kan thria tangai mizo thalai te jinga oh all right chon kha kan thria tangai tin he chu bisexual kanan ti ang chi te po kha kana chinan soi te po ka relevant lu to ka enge hey toy kanan ti meta mizo chuanin hetiang gay men kanan ti te poi bisexual khan tam lu tuk ta ni hey kanin kom ngai ta tro we like hey toy te chu me che te chuanin kom ngai tlang puya an lo mel trave thek thok box se ma se tam takina me che han float pui me du te po kha an om ve tho ti kha tiang ta ka hriat tu in hriat lo mi apon kha tiang kha an om to ani ti kha na china po kha na ron soi chianga kha ko ron confirm le do kha tiang khanin anal sex hi enge risk asan vi ka wang khanin enge vulnerable kha chu ato pha chuanin mei che kha in le tho ti kha kan hriat tangai all right mi pa kha ni lo mei che kha okay so khatiang ta kha enge khatiang ne no ta kha kan soi tel du lo ka chana chu heta research kan nei to wangin an thil soya kha thil dikani ti kha kan ron enge ni bel cha lo ka ni chu hey hun ka mang rei vak lawanga chu ka soi tong khanin self test chu pahni oma saliva base le blood base oma tuna hian India hianin kanon mang chodona government approve ani lawa amar chu kan findings atang te po hianin I tikhanin kan thelu tanga man nge chu aron ni don. Most probably our research will be the last one that we submit to the government of India, and then hi man chau chu aron ni thoyang ti ka kan soi do ni abak chu kan resource person tuna mi ron min non zui tur ron soi zui tur ne na hian ka da menga aron soi vek menge kalom lo to ke.
Okay, thank you, Sir Henry, for your thought-provoking ideas. Ole, to na chuan kan resource person pahnih na kan kal to anga P. Valaruati, President, Positive Women Network Society, ti ami kan so makan zinga ron tela hun kan pe anga zo na le chan na anua kan ne anga athusoi lai khan zo na a thei takin ti in lo ngai thlau lukanga anua zo na huna kan zo na race kan tum don nia to na Pimaruati kan so me.
Chỉ bị vết bule in lâu nín tụi em ní lên đầu thọ khan in lâu chút tỏ đón xe thành thoát sập sắp ba nghe tóm là mà thu sợi in thắt chuẩn ấm đủ đón có mẹ tối thế ăn bên gần tiếng choán nghe thiên lý rất thà có ôm mía cái hàng nuôi hậu lúc đón mía việc khi tổ cả khang cả lâu cái tổ này chú helai huna hian chuanin chumi chum chuan kan han che khop me ya khami chum khanin ke hi HIV positive kana sang ni pali kan HIV kan ni ti kin chia kan nu lan lai ka tle ro chwa limin chuanin national award thaka dong ve hlo me vil thlik to ka khan min so ve ta chuanin puman zuala han so ma pakhat na chuan pani na chuan ma footballer khan so ma chuanin apathum na chuanin te mar nu pui hi entrepreneur ka an so ma chon ke kha ani le ta ni chu kan topic in an lo dan tur kha in she thia manga chon motor tu lai the chu kan sei lo ka motor ka ron rui thlapok pi mai motor ka ron chuang thla luak bor pora puman zo la ka politics so de lo ham puai sel tu helai khan enge ti mi thi vatli ve lo tia lo tin sel tu ke rui panic vek to box si khan ti tu kan ti ga dom zui ta hết cái sầu đó cái hàng sầu nàng khai nghĩ sầu về đó mình ta giảm độ na cái là cái sầu cái sầu chết thì đâu à chọn tiếp cái sầu ya cái chua question and answer cái trang à chọn cái ngày tuổi liệt trang hiện cái giặc chém chuyện gì thì là individual chuyện hay thút sầu cái một trang à đi xuôi bal những mình tiếng thiếu địch lâu rem trang lâu mà cái sầu tuổi anh cái bữa sẽ anh bắt khác mà cái sầu là ba cái giặc chém mà tôi tiếng bốc chọn Bethlehem apa kwan Bethlehem viang in domem kishela wa Bethlehem pastor te khai inge kha tong trai hlan na an tiang chi shem inge inkhom khar na ti khen ti kha o ma som tong trai na kha en te umial som tong trai na ti tu min ko ni chu ui ha zai chung zong hian kan zai kishela kho ve ten ka ti don ka ti ma se ka bula mi khan câu chuyện nu khan an ti om ang lâu lứt tục kia mai cái mày đơn gì khai rằng tất cả bên không biết là ui cái sự thiam to big đó cái dài khát tối tới cái lăng cái ui cái trong trai tối khó ba anh nếu anh ti cái trong trai tối cái sẽ là bà na cái thiên là tất tục cái một thì chết tập ba to mà hay cái một to lâu cái giặc lứt tục cái bệt lên viên cái lăng bia khoan khu bia cái là giặc ngồi anh như từ cái phiam thủ cái thổi lúc cái gì chứ lâu boring lứt tục ta kinh cho cái hey kan hun tem to ka sai zo kai bo sai da nang pon karon sai lo nga PowerPoint po ka tingai lem lova chan nge tu te han ti chiam tu kham lo ni chu chuan in introduction kha kan nei thale anga ke hi chu sang ni pali HIV positive kan ni ti ke sheta ni chu ke in sha da na chuan in hen lo ke sha da ni ka sai sing to tu kan ning to college kan kal kwal sa inga to in nge kai ti khalo na sex nya ngai zong ka nei ni mo na china khanin pi ru ti khana soi kha partner te kan choose fu lo choi kan che chevek thei ti kha a soi kha i khang hun lai khang kala no pang a ve lu tu ka at nen ler nen kan form mo kan a sia kan le fi bok sia chuan khata khanin ngai zong kan han thlang kha kan hi en lo la si relationship kan thiam lo ka la serious em make up pasal tur mo kha ka tringot me ni chu chuan ngati engtinge enge ama khan chuan in hey in play ani me chuan ama kha jax ti china lo ni ta i enge aru ki mi nan la shelu tu lawa ho ma ten lo da to china ni pha ya te chenam ko ven te shat lawin tu ja so aru ta ka lo edik number 4 edik khanya ta min chenang ti hlaw box si khan jax ti ro ti khan ti du lo chung chung khan ti ro kha ta ui ha ta ti he min enti ka tiang min manipulate ka ti don nge te enti nge ka ti nge ngai tu rang chi khan ta ke po khan kan ti ve mek oi ka ti te ka luak char khat vel ha ka ti thin chung hang ka luak ma se ama khan enge kha min kal sanang ti ka lawa ka pasal tu ra mo ka ti a ka du ma adu dan anga om kha ka du top mai ni chuan HIV ato pa chan drugs etika ka chuak ta ne me ni chu rin lo lain drugs ke he drugs kha edik kha lai khan tu nang hian awareness khala thalo ni chu ka khat nuwa chuan alo re number 4 khan na thlat ni lo ra are lo te thlathum se drugs edik ka lo ni tar ngot me ama ne phe ka ni chen to thum apu ka kan drugs edik chun zom le ri ni chu ko tia ang din hun chu kan ya ti chuan ka tiang khan ni ama se drugs chu ka ngei ta a i me atoi zogin soila drugs chu ka ngei ta a roin ka ngei ni number 4 kha i enge hey ti extreme ve do me hi kanya ka ti to lam chu thei pa to chwa chi ve kanya ram hun veng lai om kanya kan venga khanin camping an siam ani chu number 4 ngei kha ka dul tu ka ngei da mun tur home tha le kha om box si lawa ka lu to pa ke ma chia me chia ka oma chuan i kan ko shan upa ten min vil to pa ka muak chwa theina lai han tui hi chwa ka ni me arap thak lu tu ka chuan ka ke ma se i kan ko shan upa te khanin i chhuak mai don mi treatment ti ilanga an tia ma se ke ma chuan hei ka ti ta sa to a helai huna pathian min chan puina ka nga ka ngei theyang ka ti ni an ma ni zo kha min be don puya amai ro chu i pathian khoi na jar ka tal chhuak ta a tu han kum som ni chuang to a kum som ni chuang to a drugs ka nge changin chu kan share du chawa chuan HIV positive kan in huwa ka positive pui thonian kan in nei ta a i voini han miron support ta hen han i boy lo ding lok te boy ti do na lo chan ding thadu lawa ani hi HIV positive sang kha za kwa som kwa pariat kuma in sha khan ni to ni dam do yan a in a chen khak no te tin la ning a nge la piang lo zok me the ni ro chuan i a fei chia an tia kan thenam ko veng ho chuan mo mani adam lawa in pa chu fei chia an tia chuan kan nu pa han fa kan nei tu na hian kum som paruk tu September thlaina king to na positive ve in nei kan nya chuan dan khat nei kan in nei ani ngadi dan khat nei kan in nei kan ti na chan chu positive kan ni ve kan piang thar ve a chuan positive network Mizoram pol ma sabara secretary nia chuan ka va join ta min nei lo hi lau lu tu ka dei lo chuan atia ke ok lu mang te kha ti amoni ka thei hil to kha chu chuan fa kha kan han nei ta a i enge kan fa pa kha tu na chuanin hei i HIV te po ka hanin puanga mu a I accept via win kan share a kum som paru kan do in ni te po local ve ro te hei zirna in sa bara thu te kan soi ve do nei local ro ka ta chuanin ngai lo min din chwa ti rang i titlata adu lava ma se a confid tu ka tu na chuan a confid tu ka mania school kal na po interview ne public speaking ti thina min lo ti top tiang vel chu ni mo ma se ka hlau thon chu tun ang khovela I kan environment a hian in puan na tak ala ni lawani chu HIV in puan na tak kina ka soyanga thin sing le endong na kan to na sa sia ka soyanga tu na chuan ni kum som panga som paru ka ron ni chawanga ala except thil kha alaman tak don lawani nakila chuan mi ambitious takte mi ani mela tu na ka lo me in kan kal ko han hei thil ma son kan tum chuan kan kal ko hian mi poi kan soi tum lo po hian มีป่วยกันเราสวยปัดชีนี่มาสอนกันตุ่มเดละยันมั่วข้างอาคารข้างแต่หุ่นกัลเท่าเซลังอามาหินุ่งละมากันอนุเดป้า HIV positive เนี่ยว่างั้นจีเทเดหมูสิเตอตัววังตีกันลาว่าจุมีจุตัววังตีกันลาวางยันเฮเอ็นที่กันยัง HIV awareness ให้กระจังเลยส่วนละนี่จูอามา confidence ในที่นั่นตัวที่ยันโปรแกรมช่างอ่ะเฮ้ award ที่กันเราดงเวทีฮีก็ล้อมนั่นจูอัดดังได้ก็ฝับปาวางคันก็ล้อมอาจารย์จูอันนู้จูวางจวนอันนู้เลยป้าที่คำเพจโตเป็นมิโซรามาอันละอันนี้ที่จงคันวันเช้าเสกดูนี่จูกันหันสวยด้วยนี่จูจวนเห็นเรามิโซรามาเฮียนิน HIV สร้างตัวอย่างกันเตียอดีกาเขาอินเดียรามาเฮียนกันสร้างลิโลลักะอีกันสานดานนะพวกกันหน่วยเจ้ามีไอคันกันหันสร้างตัวกันนี่อีข้าคันนี่อีมีสร้างนี่จะสริเวลเนี่ยงอข้าคันนี่ตาเฮลัยโหดช่วงเฮียนมีเองจานเกลิง800มั้งอีมีสร้างนี่จะสริเวลแค่ไล่เวลาทุกข้อมิละสฟีแล้วอมข้อมชุบเตะได้มีหันหมูแล้วมีราบด่านตัวจูคดีจ้องข้างไงแต่อุล HIV positive กัน population base จังโซตินมั่วข้างที่ข้าดำตักดำตัวเหล่าเตียนเหล่าอมาเหล่าขันดำตักข้าอันกายแต่เวียชินตาข้าจุฬาจุนกิดาเจียงตาวินกรอนสยังจวนนี้อันเรานักกินน้ำมีดังเตะให้นังนี่จูอีเงี้ยมีดังเตะแล้วจุดที่ท้องเนี่ยตัวก็ดูเจ้าจูไงจ้องในฟิล์มขูดานไล่อะค่ะอีกันไงจ้องที่ทูอมให้มีเพลย์จริงหินอมมันนี่จูอินดีเวเอ็มกันสิ่งให้กันอมเอ็มเฮ้ยเบียนดูเตะเบียนปาเตเพลย์จริงประคัดดูเท้าสีประคัดบานเชบกสีอย่างเตะค่ะ relationship พี่ปุ้ยมอนยานะที่น่ะพวกขัน mental health ตุงจังอาคารรอนสวยตัวเฮ้ยกัน partner เตะกัน choose อปุ้ยมอเสียชากัน choose ฟูเหล่าจวนมั่วไม่เชื่อไปจุกันนุ่นกงฮิตเชบ่อยเท่นี่จุบางจวนกัน choose ฟูอ่างไงลุตุกันอามีป้าไม่เชื่ออินขลายข้าปุ้ยมอHIV กายเทนเตอาเชลุตุกทิลข้าตัมลุตุกันนี่จูวางจวนปาร์เนอร์ตุงจางบิ๊ก relationship พี่กังไงปุ้ยมัวมาบุลาจวนจูน้องมันนี่สิเราอมเรานี่ปนมีดังที่จิตีรังอูกัน classmate เตเละหน่วยลำเละ Sunday school ที่พอจิตีตูที่ปุ้ยนิมเทียข้างอาคารจิตีเนี่ยเปอีละอีขดยังคันอีเอ็นเราเทนาเตียงอูอีจังอูชันจูอีตูน่า positive run in ปวงชวกเราก็เรื่องเขาสอนอี relationship พี่เรานี่เดี๋ยวเสียตั้งปุยถูอินอีข้านี่กัน problem พี่อดังไทยเทไม่มาแต่ที่น่าพอ MSM อีมีปัญหาจังกายตีค่ะ8.47 เนี่ย percentage อังคารวันดาตาที่ว่าข้านี่น่ะดิกตะกันนี่ระวังอาจารย์จู MSM men sex with men เทียนอันสวยงามเรา ICTC อ่ะพอคุยจังยี่กายอันเดียกับเบียนูจังอินอันที่โอเคไม่จะประคัดกับเรา flirt ตาเตียนตีสวยงามที่นั่นจังข้าดันลานี่ไหมสวยงามเราข้าตั้มโจกันดันนี่จู่ว่าจะอันตั้มด่านจู่นั่นที่นั่นสวยอังเจ้าขันไม่เทียบีข้ากันเรา vulnerable ลุตุกอีเองกี่มาขันอีเบียร์ปาขันเบียร์ปาเราเนี่ยไม่จำป่วยลุตุกอังคายเสียเมมจู่ไม่ดันนี่เราว่า drugs ที่ข้าจะรอข้าไม่เทียนตัวบีกันเดียaffair เราก็ตีตัวนาย research อันนี้ก็นี่กันลงให้ filter เดียวมาหามีสิ่ง research ในตัวเนี่ยตัวนักขันเฉลี่ยตัวกันลงให้ filter เลยตัวป่วยกรัมมาสอนเราลูกตัวก็เปลี่ยนนี่ป่วยก็ตีตอนมีเจ้าที่ sex มันหิ้งก็ตีเงี้ยมีปาร์ตี้เฮียนี่ไม่เชื่อที่ sex ว่ามันปุ้ยต่ำนี่หิ้งตีเทนั่นเนี่ยตัวแรงกันละมังกันละมังเดือดตัวกันละมังเรียวอินตีเองวันนี้เรียวนานกันละมังอันนี้โดดอันนี้กริ่งเราค่ะอีมันไล่ถอนทัวปะนี่เอ็งที่หาคนเอ็งที่กระสวยโดนนักเทศะเบียร์ละกันโดนจวนปะแล้วน่ะไซชินอันที่ที่ว่าไม่เฉยเตรียมขจูไม่เฉยเตรียมขจูปะแล้วน่ะไซชินอันที่มันไล่จังคันเซ็กส์ค่ะกันเราว่ากันนี่จูดูไหนเจ้าวันนี้เรามีเจ้ามีปะเขาขันไม่เฉยเทตั้มนี่ค่ะจลบุกจังขันเราจริงตัวตัวนักกันสิมุดขจูฮาร์เวดเอาไว้เทมาเซตัวจันนั่นเรานั่นดัมเทตัวเราเข้าอมตัวเสียใช่ไหมไม่เฉยตั้มนี่ยิ่งว่าขจูตัวไล่จันจังกลางตัวเราอันเราอมตัวจอกกันง่ายสร้างตัวเรากันจีรุดลัดตัวจุบันจัน i kha kha kan soi dua chuanin i tin ngai zong kan han nei ta a mi te hianin i thil pakhat ka zo du chewa dam treatment tha a om to a chuwang chuan HIV hi a lo om lo ki chu ka hlau lo ti zong ba han par teu pakhat treatment tha om lo ai hlau lo che amo treatment tha om to a HIV hi ka hlau to lo ti zong kai mai la poi hlei nem ke chu ka sex chu kon dom pok a mang pe lo a kan ti tiang a ka lo pha chuang lo ka lo pha lo dam doi om to a henge ti kha in a mem ban han par chin teu mi hian ti ve ze a kan mi thiam tak tak ka rin lo tak tak an min ka soi lawang ti hian positive ho chu dam doi an nei tha a dam doi an eya chuwang chuan mi hian HIV an lo pha chuwang alom kan pun an tia vo in na kan topic kan enge kan theme han issues and challenges ti ni ta tro chu kan mi he ta kan ramro real tu te ngai da ni tlat ni chu in thing kan ti dang lam theyang khi ka ti top research nei te ka du hia la mo asan chu dam doi wanga lo hlo ngo thein lo diabetes po ro diabetes te po dam doi an ei renga an ni te phei chu om huna an in eng tinge kha an in te strength theya kan lo pha chuang mia lo tu ro kan lau tho thil khum lu tu khani ti ei don the ui ka zum thum palang an lo pon thla tu lama tang zum thum kan ni phei chu kan lau thin HIV dam doi om to a an lo pha ti te kha an han i ka rin lo lu tu he tiang lam enti ka tiang mal la tu te ti to meng mo te han soi pap kha chu ui ka be hi dong lu tu ka a feel ta hian om ro hi ka ta ka ruin do ka na ro rel su te ka ka mai ka lo ang vel thin ni se om zia om thui lo ma se he hi chu an ni lo ani mo dam doi wang kan lo chu ai ma chuan kan apoi zo ka chu engwai nge kan HIV adar zel kan ti chuan kan bul hnaya hian omani ti hi kan chelo kan bul hnaya HIV ka lo wang ani lo da chin an ron soi to ang khan ama chon KS man pi don ta la kon to mi mangang helaya i eng lo nula chelo ve tak me model ti ming pu mo chelo pianal ve tak kha i sexa a easy ti lo she ro ve a i lo man pi do na kon to mi mang nge yang masa ibian nu fel takang ingai zantina in khom chin pa ngai tak ni angai shat kha i ring ta a i man puya pero zu chang cha i kai de the chu tiang chi li chu tun lai chu positive ka kan mu chuak ta ni chu mani case pa khata po kum som chwa in ngai zong to an ve ho pot in nei tu rin ngai vek to pastor fa ten nya mase thil dang de in entira lo positive de khui trai ngen tan hanin zo ta katilo an ti ve box ya wala chang chan ron tla big me alawang pakhat zok kha chu binom lo ti na ni me mo chuan HIV chu wang tak chuan kan bulami kan rin em kan trust em te pok hap eng lo the ni chu tin nang ni poi in kai thei ve kan ya in kai ve thei ve kin ka kai don me lo ti na mem pa han par te u ka kai don lo reng tingam thak hoi sen takin ke HIV ka kai don lo ke chu han ti te u han ban par te u ngot tingam lo mi pakata par alomom mase nupui nei tu mem inupui ke enge chan chen kan sheme alo tu ko kan chunga HIV positive thian ui ke in ring lo reng anti vek kan nupui pasalin la nei don indin hun tu in shelo nupui pasal kan nei do chan in test te kha tha o kan in test sang ma se ta chan la pui le chu ani nei do in test sa chuan anua ani nei zo a khan ani nei zo anu pa chu in hau in ti thin rim te lo oma anu tla na pakhat kha wil da vera zu lo fa in vera me cha te kha lo enjoy pui vel ta ani chhe chang khan a in nei de kha lo kai ho le khatiang case te kha tam lu tu soi tu kha om nok ani atam lu tu kan thazen na soi tu kha om nok ze khatiang chi kha in chena let leng chi kha mo an soi kha in chena le position sang ron she ho to an soi ang chi ang kha chuan kan film kurangai kong eng kima sex shim hian I enge chuwang chuan condom manangai ti na ni ta ni a kan abc an soi chinta a chu insum theina te biakina po kan zir soi po ngai lo insum theina rin omna kan soi chu po thudikom sa chuan a to pa condom kan hmang talo chinta ni chu condom hi engwangin nge kan man lo nan chang te upakhat khan engwangi kan man thadu lo na chan ni shat mo enge kan man thadu lo na chan mi pa ho hian nga tinge in ignore na chan in yai tlat na chan hi anom lo wang a eng lai chuan nge ti nuam lo avun ma ti to na lai ni ti deu mi I awam zia chu kan ril bu nya tro HIV sex po heta nya kan ril ru khan nom ti tu mai tu nat na kai ai chuan condom man dan te hin lo she lo nge in sha em borak ripup pup condom ka demonstrate don em ka she lo hun om cha kan ti don nya chuan U equal to U condom kha kan manangai top tu na hen HIV prevention chaber chumo rin om na insum theina kha kha chu kum som ni kalta a kha nan soi to atri bai om thei ang perin tu thein kum som ni chuang kan kum som ni ka thok to a kan pa phei chu kum som ni chuang thok to a HIV chi bai om ti char ngai char ing ma kha thla kan reng lo chu ingai to na lo sem ve ro u inga tinge kan thak lo kan thla ka hun to lo mo awareness kan nei dan te hi ti ro ka soi pop don ya ki chu central YMA in HIV positive te pathian chi la HIV ikai lawang ati mi tingen tar kha HIV positive pathian chi an tam lutuk no pangte te kha an positive pasal changa kai an tam lutuk pathian chi kan Mizoram ko shan liam ber thalai pol pon tu tiang to an ti chuan atak tak rama a feel ta an ron lut lo ti na nani po HIV feel ta an na tak in ron thok don ni chuan HIV a MZUSC a invokal ringot theilo ki chu HIV vela ma an lak reng hian ati tak le tak lo chu du mi a chen chuan lar du na ten ron manga a chen chuan sum hu na manga a thavek eng a reason kha chu eng po ni ro se maset na taki thatakin anron thok tu ni ti ka ngai dan ni chuan positive network pol positive women network kan oma Mizoram pakhat che positive pol kan oma chu po ron thleng thei lawa positive te tan ma ka la ti ho hi chu mo ma an na du tak em ti hi ka zo na sha thiam em chuan khatia angjong ma kan lo la ve du ni pon grassroots te hi thu kan nga thatu ani do ka na tangin eng ma sha thelo nang ni pon akina officer te in nia nga do ka na tanga ro rel vekin tum cho in ti che fawang midang te grassroots worker te a field the thok te eng department a po khang ho har san na kha in ngai thak lo chuan na in thok tha thela wang sei le to se mi som tai lo trai le to chuan Mizoram thin shik na le endong na hi anasa to anasa in TM in mu da nangin HIV positive te kan thin shikin kan eng don to hlei nem ti angjong khan in ngai to em nang mani a tu tan do cho in mu em na mu tia lo mi in thin shik lo in ma ka dinga thin shik ti ka chu nuam big don lo thin shik na la na sat dan chu mo thin shik na la na sat dan chu moi takin min thin shik thin ni kan in lo na te kin tan mi in kan lo lo ta positive kan ni ti an sha chuan he in kan sa thado na ni lo chwa san theim a moi tuk min musik mase a chan chu kan to kan nu pa hian kan in dang nimin in pakhat kan lo a ka chanu min mu sakani in kan nei lawam kan in dang du sia kan in kan nei lawa kan han biani an chung kwa po doctor anom shetu lu tu kanom to an han bita a ka chanu kha min biak sakani chu HIV thokan nya ti ringota positive kan ni ti kha soi ti lawa lo thok ro se lo lu ro se I lo lu ro se kha lo ti a thla thum nu vel an han she chua kan positive ti kha pa ber kha lung oi to lo ka chanu bula chan vakal enga tinge hei ron shuai luwa nga ti ron ko mu kan ve ho hian nge min nga yang ati ama chan min hlau chuang lo ma sen ve ho chu pu de thau chu she thia mem ui kan chua kan ti kan hlau lu to ka chua na man ron sia mang kan te kan pa lung le ka tholai ne min post line kan pa ka phone tui ren la in leng ne reng lo bok la an soi tu rom shim an chua lam khap pakhat ma lo en to su kan ti achan chu kan line ti a khat yang chua lam khatam to wang khan ma se a to pa chu kan chuak ta nge nge a chuan chu lo po in lu a har san na kan to le chu rap thla ka ti tu ka soi chuak thangam lo shin zo ka acha chu ka chan chung ko ve thawan ni wangin colony pakhata hian omani chu in nei tu ate po doctor la nom tho ta po chan an fa de pakhat ka close friend lu tu ko oma lo lu ara u kan in atia kini ka kheta kan oma min shelem lawa kha colony a khan in khatamani thum ko som thum vel khan an luani ti han in khan nga khop meya chuan ta chuan ka wat en lo I kan bia a ai an ka chian ber chuan I an hei in nei khulaya kan in luati khwan an chung te luati ve tho an du si an ron berenga man ho tawin kanu le pa sha lomin kalau hei kalau shil ruang che in lua man kha ron king top la ron da la chuan a ron da ma sa chu ni meyang ka thu ve si lawa hei ti nu le pa thun wai de om chi ang khan ni ta chuan tu atiang che chuan ka ti ta chuan ma se kha an lo ship chua ka ni chu mun tanga tang khan anin hor kho ma kha mi lua du tum tu an ko hu tu ten chung kwa khan in hor khoma HIV positive in ron lua do na hi chu theilo a hu hawin in nei tu din a han kalang u an tia ke mani an midang ho khan min she chiang si lawa HIV feel ta an thoka tu mi khami ti lam kha she to lo an sha chin chu HIV positive an nu pai na ni ti chiang sha o in lo hlau ta lu tu ka ti khan mishing chu khat an soi khan pakhatin tan pakhat he ta shir ruwa to pa chan ni lo de lo chwa to kha to pa phe chan zungol ve nu pa in kan chuak to an soi ta chwa da la chan ti khan anin tiam wala chu chuan in som ni som thum in ka khan chung ko pani cha kal ve du lo no ma bak zong chu an influence ve kan kala HIV in ro la ti to na hi chu kan ngam lo fa te kan nei si an te chuan in nei tu atina rima a chan chu in nei tu kha a thin rim na chan chu in nei tu alwa tu ten ro an real tu ni lawa chuan an mani ke mani te por wa ti te pon an lua lo bokanga kan da ol shi ang an ti ta chuan mi ron phone an ipoi paisa ron da ron ta paisa ka la ka ho chu ka ta hi a chuak lua apoi ta ber chu kha colony a khan HIV positive pakhata om an shelo re kha pa in thla shun dan tur ja tu khan ngai to ta u kan bu hnaya an oma kan she silo in buang zo ka ti kha min ta ma se mo tu na chuan ke ma ka ni ti an she to a khalai anin ka kalpel ti ha scooty in buang chang de kan kal chan ra ti an ta min piak ka piak ma sakan ngal anin thla shung lut tu nang ma ini ti kan lo she lo ma le ta ke ma po ni lo mai la khatia ti kha thalo shim ani chu har sana kan tok na sa tu ka fa pa po an lo kom du lawa mo atam lut tu no pangte ina asoi om lo tak anu ka lu ve pian computer and off zera horu an ti zera te chuan an chan pa pakhatin anu an chan pa ka fa pa chan pa chuan an te line ta kum nga ve ani line rafela local ve piang chuan ani in horo min ti zia local ve lo me ro se atia tu chiang lu tuk tro vir ku chun na du lu tuka engwangi ka lo in puan ti ka ngai to chena tuna hian kanula la in puang kanya fa nei to ila in kein puang lawang fa ka nei ta si a kan ti tangam lawa fa ka nei ta si a he Mizoram hi in puan atla kan ni lo tuan a lo thang le nga tuna cha la normal collation kalanga din hun tha a te po lo la ding ve ma na en tik nia mo chuan amo a che zong pon kal thei min an diriam tu ka ngai ngam lo thina chu ka chak lo na per ani chu ke ma hi chu eng tin pon min ti se ka strong tol tu chuan an u equal to u kan soi le anga cha ka tu tok chuan ngoro thinshik na le entong na kan soi be le lok insurance a khana te kan phalowa thinshik na kha sarkar atang pon kan tok na sa ni insurance health care scheme hi kan ti ven phalo ni chu tu na yan phal chaw ni mani de ulok khan meeting a kan aw na salu tuka chuan doctor te pon in niala HIV positive kha accident ve thak ki ru khat lek ve thei tho ni chu wang chuan an ti dan kha affair lo kan te kan soya ke phe chu por be bra ka tang thin rim to aw na sal tu pon a khan ai medical superintendent khan min beng ipoi ka soi cha min ngai dam na a khalama ni lo ka poi soi kan ngam ni lo i fanu chunga tla se i chung te chunga tla se enge ka tia kan soya ma se ta khan hei enge kha khatia kan tum lo do wa fight hi ngai chin ni chu mi zia lo ang do ya wa fight kha ngai to pa chuan min han ti sakna sa le khopa an ron phal ta ka chuan he ta office en kal po ngai lo nang ma ni veng chunga poin ka lo positive ka lo ko khom ula in office a kan ron ti ang an ti an wak to me khopa sin ma se tu han LIC a te i insurance an la phal lawa khang te pokhat tin ching de endong na vekani na tina kan counselor in a soi khatero na di la khan e wangin ni HIV khan phut HIV ki death ni hi death sentence ani lawa manage the ni he disease in manage the nya ingati yan phut WHO pe chuan mishing dam chen dam doi thataka e chu dam chung adam the ti pa ngai ta kan dun chuan le treatment tha taka pa ngai ta kan lak chuan hi kan pa te po riat vela an lawa a positive a tung kum som nga panga nya positive in puang singa chuan a upa ber to ang nga nya kan yual banjika pasin ka piang ve cha am se wase mi pa upa zo hi lo thal tu me cha khan lo shiru min dwa do lu tuk tu wa chuan thinshik na hi a om lo an lo ti chuan mo a om ani ni tin pali panga complain ron lu ta anin hau tekhina an mo nu khan a positive ti kha lo sheve a ni e u yak lo khongai lu tuk amar chu thu chian han nei che khan nang HIV positive han kha chi kha she thia mem thu chia an nei pe hai kok in ko na nan manga in thinshik na nan manga tungi in puang amang HIV te an lo in puan chu wang chuan ania HIV hi stigma and discrimination hian HIV atidar ti kan sia em HIV tidar tu ber chu thinshik na le endong na hian a chan chu mi te thinshik tu ringo tin thisen kan vates du em ICT sian kala I po han ron chuak ta a I sung te shilanga I ART ya alo wal au ve ang ring box e ikalanga tu tiang tu ringo chuan mani la thatrul tho box si chuan ti lo me kha cha ko mani chu tu na dam doi e lai te tiang ho te kan hlo om lo a chan chu om za chu u equal to u kan te u equal to u shi toin omem in la sheme alo mo in shat nge nga u equal to u kan tia chu kho u we sa te mun da an kal puin sa to lutuk undetectable untransmittable an tia the ART dam doi hi a hun malama chuan Mizoram sang ni paruka an ron da a chuan chu positive zong kha e yan la phal lawa chuan a side effect kha arap thak lu tu kan ni chu hei zallama te mu mangrap thak pui te kan neya a chen chu mi pa nu te kha thei ni hei ta biang te khwara buffalo ham te kan neya arap thak lu tu mo enge kha inti ka tiang thua ka khoina sabok ani shom kan tia side effect rash te hei vun ponal theilo ni engma kha dik theilowa ta tu nu hian kan doctor pakhat pe chang chemo khai ang rangin ni min ti ui ni cho kalova me tho om ve chemo khai rang ang ni chang ka ti vera fiam tuin chuan kumlikal ta khan dam doi chalu tuk iwe sa pon e ve to ramchang kang ina an e ve to ho kha an ron petani Mizorama chalu tuk a wonderful drugs an tinge hia hianin o wonderful an tinge ni at an ti na chan chu kan taksa HIV ani ART hian kan taksa a hian antigen na zuk tho ART kha kan e ta a ART kan A0 kan A0 la antibiotic ang ve deuh hina A lo chuan resistance nei the nia du hun A lo A ya thei kha ni lo ta A reng angai ta ni chu ani lo chuan resistance kha theya e damdoi kan han A khan kan shik pa ya kha azuk timu hil ta ni chuan azuk timu hil la ti khan ai in thla pung thei ta lo ta in thla pung thei lo ta zel ta a chuan kha khan nan na sang kan do thei na I kha ati chaka chuan he ba ngai ang normal life kan lo thei pha ta ni chuan chu khami ni tur khanin hun re tak e yangai ta ni ma kan dam doi e chu tu na mi chu ni ta lo ta ni tu na mi kan dam doi e chu HIV positive lo ni ta se kan cham pa hi ai a shi se tha e male and 0.5 eng me ma se positive tlat thathum ai khan undetectable untransmittable ani thei midang akai chon lo theya an hu lo thei ma se ama chuan shik chu alo om thawang adam do e wang khan chu wang chuan kha undetectable untransmittable om tir kha positive te kan tum ber ni ta ni chu dam do e hawa hian chuan kha undetectable gen nu pa han undetectable untransmittable kan nia namani han sex lo mang taila ikai don lo ka 100% athan chu WHO te engkim zir chia na ni kan chanu kan no pui po apasal ne kum kwani nei to a fa kum ruk min ne apasal kai lo wa fa po kai lo tu chu ka soi nep tum na ni lo HIV kha ma se dam doi na tho da na ni mo chuan chu dam doi chu ama kan dam doi kha chu hun re ta kan ei nuwa undetectable untransmittable kan ni thei chawa tu na mi chu thlathum le ka kan ni theya thlathum atanga tharu ka kan ni thei ti na ni chu chuan ama ero chu poi ta deuh chu ka ta chu kan soi lu du chu early diagnose early treatment ti hi doctor ten an thu pui ania Zephyr prevention is better than care atiang deuh kha ringot khani to lo early treatment early diagnose early treatment apoi mo lutuk achan chu mo positive kan lo ni ta a HIV positive lo ni ta I tekhinan ignoring ai ti lu chuan mo na kina chuan tekhinan mei ART dam doi ka lo e ta a ke in shi chuak ta kala nawak lawa a la shi lawang kan lo ti ni mei theya kan lo in shi har lu tu kan ni chuan nan na kan nei chu to chuan kha dam doi kha an tho tur angina thok tha thei to lawa he da shi sel ve de uhlek atle mana chak lo de tho si ang te kha chu undetectable untransmittable han thlen ti wat the ni chuan ni si lawa na to lu tukina han ei khan re tak undetectable untransmittable ni tu khan a be fe ngai ani ai tang ngai ani lok thei lo na sang kha anei reng mai ni opportunistic infection kan ta hei ti sang na kha chuan anna sa to le leng phe chu ART khan pelo top to an tan tur ni to ni chu wang chuan ania early diagnose ti kan soi war chu wang chuan kan that tung anga kan in ngai lai pon risk kan omani chuan risk kan oma tanga thathum na ti sen kan test tu ni a thathum na o ani nga na vela ni ravin hey message mi ron thon tu ten ron man mo thei khom en ting sex man no ber kan ta nimin pia lokat ti chu kan mu theyang ka ta law lo am law ma la tingai na om lo ka mu thei lo kan thathum nu a cha khan mu thei ni chu an sex mun kha kan shia ta ngai chu wang chuan film khur kha angai ni chu kini ho chu kai lo tur ngai la in lo kai ta ka le ka in mu dia langa chu wang chuan in chuwang chuan in tu chuan kan in awareness kan nei atop na to tur awareness kan nei dan hi ka he a fulo ani to ana hlau chibai om lut tukin kan in zirtira kan chi lutuka ani levo inia hian kan zot le lok chu ni tin om pu e le in siam tu tur khat om pu tan positive I wai ngamem fatin ron kal san mo nia nga tu ro fatin ron kal san nga ni tin positive kha fatin lo enkol tu wina da nga mangem chu HIV kan in soi anh kai thon le kong li chau oma kong li chau thì sen thiang lim lo do na tangin sex atangin nu naw pa ya tangin syringe thiang lim lo man tangin pali chau om lain chu min lau thau thau an thin lunga khan upalam phei chu bet tlat to an chi tau lak lo za an chi tlat to me ni chu faka fa pa ka neya kum som pa ru ka na kabang ti te pa oma kabula en tiklai pon oma kai lo reng sa bon kan in man trom vek ma se hygiene te poi mo vi ato welin man trom kan rem ti lawa eng kim khatiang khan ati ring kan kalpuya mi pa ngai te ne en kol dan khadang lam na pakhat ma om lo ma se an negative ani a shi sel tha em boka pathian zara chuwang chuan thin shik na khami kha atam pau le HIV kan pung zel don thau thau Bangkok hi sex city ne tro night life phe chu bon tuk in siang chu chen chun kal tonga HIV and control HIV and control tlat a chan chu a mun puya khan thathum dana thi sen ten te sa dora te self test na ten vale me 7-11 ate an tu den vale Cambodia te po uncontrol to HIV ngati Mizoram in kan la control ve thelo in ngai to ne lo mang ra u fear factor ring te insecurity ran engi omzia anei no ngai to ve ra u tu chot eng rang e thlen positive in puang chhuak hi tlem te chau kan ni ai puang chhuak om chun po kan in thir lek lek changa tam lu tu chu wang chuan ala tar chho zel don mi be dong te khovela mi hlo om ber ten ni mi be dong mi kai dar du chak tak tak hin tam lu tuk tam do e chadu lo khatia ang khania chuwang chuan khongai takin vo in ye local khom claim te ni maila ki HIV positive drugs addict le ngal heta underdog katime street dog ne nge danglam na om drugs kadi lai khan mase HIV kan ni ti ka in shat khan nun hlut sia ka sha a khe khovela hian enge ti kan ti tur ka sha a ka thei patop ka chho a tun din hun ka thlenga I ka phulo pui pui choi moi na te ka donga kein ka tun thei chuan nang ni phei chuan in thiam na zong zong te nen mo in thei patop in ma han la ve ta ula chu danglam na hi thlengang he ta thilian pui ani lo small step by step khan ati thei ani kang ka lo request chu thin shik na le en dong na ti hniam tu te thudik in soi thei ni lovin film khur tur in shil shat le in soi thei hi adang lam covid lai pon ani kha film khur tur in shil shat le in soi thei hi adang lam covid hun lai khan kan chuak na satuk dam doi sabin kan te kan wak chuak na sal tuk kan chung koin kan tuma kan positive lo achan chu ain ve na kong kha kan apply a mi ti angin kan in kong kha ra lo lu su I ron lu do cha mask wala I kut tuam ro kan ti lo kong kan ron ki ka mask kan lo mo a fit thum da fit nga da kan lo om me akal phung kha a omani khami kha zom me tur ni ka do thin shing mi ru kan tin na chau the soi tu kala nga lu tu ma se ka du to kang atai to kalom lu tu in zinga thu ka ron soi the ya I hei MZU ti chu kan ngai sanga kan rap phave lo re kan ni te kan no rap ve so tha ta khen lo lai o sa Henry ti nen khan kan ti ho hei doctor ma I pi ma I hi HIV ve tuk ania a ve lu tuk hi a boy thak zo ka kha hun lai phejan wai me te ne na in fight chang khan nya bon lu tu kani chuan ani na kan kal to chuan thil zor kani chu a le nge tu mo in ti top voi dhian thil lo zuar tu ka thil ken re hi chu mo he inge mani thil han zuar la amo ten jam marwa ti thil hi chu ta I midanga po hen min zor sak ze tiang chuan mi hi eng ti nge ka tiang a vei lu tu ka min tong trai pui reng kan do pa hian cho Sir Henry a boka ani hi kan office a lo kal renga thil chan chin mi ron zo thin ani chu ka ngai na lu duk atir tengin voi khat kan in mu tir tengin HIV chung cha khamin sai pui ke lo tui lu tu kha sai tui lu tu kha kha ka ngai he amai TV a ka mu to a ka ngai sa ru khop me a nu khan kan takan mu kha HIV kha lo tui ve ta pya na oi no ami ka ti khop me an bula thil soi kha in zir ti tu te an smart lom ka tia MZU han ron lu ve me ka du ni kalom lu to ke min lo ngai thak sak uluk taki
oh pimaro ti chunga kan lo ma interesting hle me ya kan zinga zona han zot du te kan o kan o kan lo ani ange achiang to ka ngai la zona lo chuan tu na chuan kan resource person te kan felicitate anga amasa in then Miss Van Lal Ruati. Katikan vo India kan program 1-day seminar on HIV, AIDS and drugs issues and challenges chu kan to anga dar nga ba sa omdo na ho na lama kan buai lo tura kan nga yanga kan ngai kha asar Henry ate lecture atangin HIV self testing apoi mo hle ya HIV kaina tam tak hi HIV pai ni ti intrela watangin an kai thina khami ani awang khan ma ni le ma ni ke ma ni on status kha kan hria chen apoi mo ma chuta chuan kan chua huna te pona kan ding lampanga khan HIV self testing ti na kha lo omanga chuta chuan self testing ti theu kan tum don dia chu ani anga chuan announcement dang le nak tu ka dar som le chan ve ya heta hian workshop kan nei dona khami workshop kha mental health coping and stress management ti ania chuta chuan 10:30 ya sharpa heta kan kim le vekanga HOD te hna tangin permission kan nei veka attendance an pe don cheu ni chu self testing kha nak tu ka po hon ani dona in thriat te hna message kha thon dar ula engtiklai po in nak tu ka ron kal topin mani le mani testing kha ati thei ani e over in nia participants song te in chunga kan lo me